Colleagues, welcome to everyone. So today and tomorrow we will participate in the Scientific Practical Conference dedicated to the European Cystic Fibrosis Awareness Day. In Europe, this day is on the 21st of November. We're happy to say that in spite of the situation that we currently have in our state, in spite of the war, we are still doing a lot for the sake of our state, for the sake of our patients. And over these 2 days, as you saw it on the agenda, we will have a lot of informative presentations, and we will have a chance to ask questions, to have a discussion, and to go to the strategic action plan for our state together in spite of the bloody war that is going on in Ukraine. The conference is entitled the Day of Cystic Fibrosis Awareness in Wartime. And first of all, I would like to express our gratitude to the Armed Forces of Ukraine, to the guys who are there. We need to mention that we have not only men in the army, we have 42,000 women in the army, and 5 are in the area of the hostilities. So on my own behalf, I would like to say that I'm really grateful to them for protecting, for defending our state, and for giving us this opportunity to have a meeting at this conference and to discuss relevant issues related to cystic fibrosis. In the room, we have the heads of our centers, their assistants, NGOs, friends from Slovakia, Poland, people who are not indifferent to the situation with cystic fibrosis in Ukraine. And I would like to start this event with a minute of silence in commemoration of all those who have sacrificed their life for the sake of defending Ukraine, and of the patients who unfortunately have died over the period of war in Ukraine. Thank you. It's in fact very difficult to be talking after we have seen those little kids and those adults or young girls and boys who have perished and died. And besides losing such children from our community, such adults from our community, we should also mention that the war launched by Russia against Ukraine has taken the life of 510 children. They have killed Ukrainian children. They keep killing Ukrainian children, adults, and destroying everything we have been fighting for, we have been living for. But we are an invincible nation, and I'm sure that victory will come for us because we are on the side of the truth and the good, and we will do all we can to have this victory in all the front lines and in all the domains. in all the front lines that can possibly help us, Ukrainians, to build our state as a more successful and a better state. And let's hope that in the nearest future we will be joined at such events by more friends, more colleagues coming from our countries, because they will not have to run the risk, and they will attend our conferences, and together we will build a prosperous country. So continue with our event. I would like to mention that the first reporter at this conference is Natalia Ostropolitz. She's the person who has really done incredible things. She did them in 2016. This is the person who really helped all of our colleagues dealing with orphan diseases to build the system and to expand the programs that are funded out of the budget of the Ministry of Health of Ukraine. And she has enabled adult patients to get vital medicines. So, Natalia, the floor is yours. Good morning, dear participants, dear colleagues present at the conference. Let me express my gratitude to all those who have joined this event in this tough times for Ukraine. And it's really difficult to be talking and in the moments when our children are being killed, when our young best representatives of the nation are dying, and when buildings are being destroyed. But as Larissa has mentioned, we are an invincible nation. That's why my great thanks go to those people who have joined their effort. These are doctors, representatives of patients, organizations, and on a daily basis, every single minute, they are defending those children, those patients. They are defending the right to live, and they are improving the quality of life. My great thanks go to them. I would also like to pass you the greetings from the team of the Ministry of Health. I think that altogether we are really doing a great job. We have got some developments and some achievements. I would ask you to share the screen with my presentation. Colleagues, is there anything wrong with the technical side? Please, next slide. So can you see it full screen? Because I can only see a part of it. It's full screen. Everything is fine. So let me briefly cover the basic activities. You know that the order of providing assistance to orphan patients is regulated by the resolution of the Cabinet of Ministers number uh, 1235. It was passed in October 2021. And this is like the action plan for implementing the concept of developing the system of providing healthcare to patients suffering from orphan diseases. And one of the main issues is development of the effective systemic support system for patients with orphan diseases, and we developed this action plan to provide healthcare to such patients. Please move to the next slide. So the main tasks in this plan. Next slide, please. So one of the core tasks is implementation of OrphanNet. You know that we've got more than 8,000 orphan nosologies globally, and it's very important to have a system which is a national classifier and not to have amend the order every single time concerning the list of orphan diseases the way we used to do. There is good news because now almost signed is the memorandum between the Ministry of Health and the French side, which is the INSENT institution, which is the owner of OrphanNet. The moment the memorandum is signed, and the moment we are given an opportunity to use OrphanNet, the overall task for the community of physicians and patient organizations as well will be to ensure translation. This tool is the national classifier, following the regulation for approving national classifiers of the Ministry of Economy. Next slide, please. I would also like to tell that quite a breakthrough in early diagnostics of orphan diseases in children is the project of expanded neonatal screening, which was launched in October 2022. And in fact, over the year, we've got significant results. First of all, four laboratory centers were established. These are reference centers, and one of them is the the National Hospital for Children. This was the first reference center and the expert center at the same time. You can see that this project falls along a number of tasks set by the European Commission that aim to use best international practices on the screening and other tests for residents. Next slide, please. That is how it started on the basis of what regulatory act. And it was just last week that we updated the information, and the data is as follows. So 150,000 screenings have been made with the suspicion that the result will be positive, and we will have a new screening. So the figure for them is more than 3,000. And positive cases confirmed is 217. So these are children diagnosed for the first time with this SPA. As you know, early diagnostics, early identification or early detection enables to provide treatment in time, and it also enables to provide for social adaptation of those children and prevent development of the disease and creates the conditions for long-lasting life of patients and full-fledged life of patients. Next slide, please. I've heard it from Larissa that colleagues will cover that issue, but since August 2022, we've got task forces working on that, and there are some achievements because in January 2023, we had the clinical protocol for Gaucher disease approved, and we had a consultation with our physicians, so the members of the task force and representatives of the patient organizations, and we amended the order uh, concerning the personal composition of the multidisciplinary task force that worked on the development of the standards for some groups of patients. And we got an updated, or rather upgraded multidisciplinary task force. And we had as the first task of this multidisciplinary task force to provide for clinical protocols for all this list of nosologists. That is the way expanded neonatal screening is taking place for 21 nosology. So these included SMA and some other ones. So we are working on that. Some of them are almost ready for a public hearing, which means that the work is rather um, quickly being done. And in July, the standard for healthcare assessment for one disease was developed, inborn hepatosclerosis. And here you can see this order, you can see those fermentopathies. And we have also started developing a clinical protocol for the inborn dysfunction of some bodies in children, or organs in children, and you can see in the list of the ones that are under development. One of the important tasks that we have been dealing with for about a year is development and creation of the network of reference centers on orphan rare diseases. And colleagues who are present in the room do know that there was an order to perform this concept. So we developed an order in order to implement this concept, and this order was registered with the Ministry of Justice, and this order approves the regulation on the network of reference centers and the requirements and the criteria for those reference centers. Next slide, please. What will this order give us? What will the development of the network of those reference centers give us? First of all, patients will get access to high quality and timely health care. Also, the development of the network of reference centers will settle the problem with organizational issues. And the main thing is that this health care in those centers is to be comprehensive, and it is to be provided by multidisciplinary teams or groups of doctors. The quality will be better, and the staff, healthcare staff, will keep undergoing trainings and developing all the time. So when this network is well developed, because so far we have just selected 11 reference centers, but in the future, some coordination reference centers will be selected out of the reference centers that we have, but I will talk on that later. Please, next slide. So we established in November 2022 a task force, and this task force was established upon the initiative of Viktor Leshko, the Ministry of Health, and it is rather of an advisory nature. It is an advisory body with the ministry, which includes doctors, experts, representative of patient organizations, scientists. So it's quite a large group. And the main task of this group is to develop and to improve healthcare provision to patients. And one of the priority tasks is that we are working on the development of the network of reference centers. Next slide. What is the procedure? So when we created the task force and when we did some work, we sent a letter of assignment to the heads of structural units. And this letter contained a request for them to participate in the development of the network of reference centers dedicated to orphan rare diseases, and to submit the documents to the Ministry of Health for the sake of developing the list of those centers. Next slide, please.
Як проходить робота? До речі, ви, як представники осередків, повертаєтеся в свої регіони.
regions, and you can make this work more active. You can have meetings with physicians, doctors, and help create this network. So the head of the orphan center, under one of the orders, submits a letter of support according to Annex number 1, self-assessment, where you provide the data about the assessment of this reference center, and also there is information in that letter about the activity under Annex 2 of this center. What kind of multidisciplinary team they have, what types of diagnostics they have, what types of treatment they have, whether they have established interaction with other laboratory centers, with other hospitals and healthcare institutions. And suppose we are talking about a pediatric hospital, so where those children should go, where should they be referred to after they come of age. If that is about interaction with other scientific institutions, so we want to have all those confirmations in the form of documents, memorandums. It's also important, and we are rather positive about this, when patient organizations express their impressions to patients, or when we have patients with specific nosologies and they are treated in that center and they share the feedback. One of our tasks for the future is to create powerful reference centers in Ukraine within this network. Maybe also their integration into the European network of reference centers is one of the future achievements. Next slide, please. So we have had already more than 14 meetings of the task force, and this is also a tedious procedure and a lot of work, because the members of this group, as experts, have to consider the documents that are submitted to them. We also invite the head of the center, who has to report about the activity of this center. And in that way, we get acquainted not just with the package of documents, but we get acquainted with the work of the center, with the profile of the center, and see whether the center complies with the requirements and the criteria. And after that, we pass a collective decision. And when we are supported also by patient organizations in that respect, and when we have the common standpoint of the task force, we give a submission on inclusion or non-inclusion of this institution to the network of reference centers in Ukraine. We submit it to the higher officials. And I would say that there are some negative examples, because we have not given the status of reference centers to some institutions. We have not denied them in access to the status. I will not name them, but there were some comments and some proposals on how they could improve their work. In particular, special attention is paid to the diagnostic capacity of the institution and to the finance of the institution. We need to be sure of the fact that patients with orphan diseases get free of charge diagnostics and free of charge treatment. That is our priority. And that comes as a priority when we are establishing this network of reference centers. So when we shaped up the list in March 2023, Order 598. So with this list, we approved 3 reference centers, which is the Institute of Neurology and Psychiatry and Oncology of the National Academy of Medical Sciences of Ukraine, in the profile of neuromuscular diseases. Also, the National Scientific Center, the Institute of Cardiology, Clinical and Regenerative Medicine, named after academician Strozhevsky of National Academy of Medical Sciences of Ukraine. That was the Center of Pulmonary Hypertension for Adults, and the Municipal Nonprofit Institution of Kharkiv Regional Council into Regional Medical Genetic Center for Rare Diseases. So we included these 3 institutions to the list. And by the way, I would like to say that this Kharkiv institution, specialized institution, also submitted an application for a number of other nosologies, but they only one direction, one profile direction was left for them. Next slide. Here is order, the order, maybe you could enlarge the font a little bit. So order of the Ministry of Health, dated July the 20th, 2023. So on the 20th of July, we approved the following centers, which you can see in the slide. This is the state-owned institution, National Institute of Pulmonology, and named after Janovsky of National Academy of Medical Sciences in idiopathic pulmonary fibrosis. Then the institution of Lviv Regional Council, Lviv Regional Clinical Hospital in neuromuscular diseases, and the Municipal Enterprise Interregional Center of Medical Genetics and Perinatal Diagnostics of Dnipropetrovsk Regional Council for orphan diseases related to phenylketonuria. And the fourth center, which is the municipal nonprofit institution of the regional council, Western Ukrainian Specialized Pediatric Medical Center. And as far as the diseases are concerned, cystic fibrosis, rare diseases like rheumatoid arthritis, phenylketonuria, primary immunodeficiency, SMA, and rare diseases, some other rare diseases. And on the 11th of October 2023, the list of reference centers also included the following institutions: Ivano-Frankivsk Regional Pediatric Clinical Hospital of Ivano-Frankivsk Regional Council in the direction rare endocrineous diseases and blood diseases, and some violations related to metabolic exchange and chromosome abnormalities and diseases of connecting tissue. Also, the list includes the state institution, the Institute of Pediatrics, Obstetrics and Gynecology of the National Academy of Medical Sciences of Ukraine. These are the reference centers for rare orphan diseases in systemic and rheumatological diseases of child age, juvenile rheumatoid arthritis, dermatomyositis, and systemic sclerosis. Also, the Institute of Heart of the Ministry of Health for such rare diseases related to the system of blood circulation and metabolism in adults and children. And another is the Institute of Pediatrics and Gynecology, named after Lukian of the National Academy of Medical Sciences of Ukraine, for such orphan diseases related to liver diseases in children. So the work goes on, and the ministry is getting packages of documents for consideration. We are expecting the documents from Kharkiv. They are submitting it for rare orphan diseases in children and teenagers. And one of the Kyiv centers for phenylketonuria has submitted the documents, but we haven't yet had the round of discussion concerning them. So please work actively with your physician dealing with orphan diseases. And if you need some assistance, the members of our task force are always ready to help you, to consult you, to tell how you can submit your documents in the right way. But the main thing is that you need the order about the establishment of that center. You need to submit the order on the establishment of the multidisciplinary task force or group, and you should also have a look at the regulation, the order on the reference centers to see what requirements are there. That's what our vision for this network is. We have the reference center for the region that can be one for one region or for several regions, but at the same time, several centers which are working within the same profile. For all of them, we should have a coordination center, and this coordination center should undertake the coordinating role in training of physicians, in internship, in job creation, or in-job internship, and also it should arrange cooperation with a similar profile reference centers from abroad. So here is probably our dream, but probably it will become reality one day. Just everybody needs to work together for this to be brought into life. Next slide, please. And here let me comment. And I want you to have a look at those orders because they regulate provision of medical aid to the patients by the multidisciplinary team. And here you can see the procedure for provision of this healthcare. And there is another order which has been approved by the Ministry of Justice. All the three of those orders have undergone state registration. So this was the order passed in March this year, and it approves the typical regulation, the expert commission in the reference center on the reference centers. So this expert commission presupposes a comprehensive approach, which is about provision of food, provision of medicines, and the selection of the treatment methods. So actually this commission can work both in affiliation with the reference centers or in affiliation with the regional or city authorities in the regions where there is a need for that. Next slide, please. So all our patients with orphan diseases have got access to the medical guarantees program, and I can just briefly tell you that patients get the services on rehabilitation and treatment under the packages of healthcare services within the state financial guarantees program and the program of medical guarantees. And the list of those packages have been approved by one of the resolutions of the Ministry of the Cabinet of Ministers of Ukraine, number 1434. And a lot of work has already been done over this period of time. We have developed the list of packages within the medical guarantees program, and there is resolution that has approved the list of packages with which the National Health Service of Ukraine will work with in 2024. Next slide, please. Next, please. So our joint task together with you is to improve the level of access of patients with orphan diseases to timely diagnostics and detection of those diseases. Another task is to provide high quality healthcare to patients and as well as to provide them with high quality and safe drugs and medical goods, and also to provide them with special food and special medicines. We need to reduce the costs of patients with rare diseases that they spend on healthcare, and they need to have improved access to healthcare and psychosocial support if they are patients with rare diseases or their family members. Next slide. So I would like to express my gratitude. Thank you for listening to me. Thank you for joining this interesting discussion. I hope that we will keep cooperating with you, and let me wish good luck to all of you. Natalia, thank you. Thank you very much. I just wanted to add a couple of words for those who are watching us online, in English in particular. And let me explain why we are doing this with a view to patient organizations. Me and my colleagues present here in the direction pulmonary hypertension, phenylketonuria. I'm the head of the orphan of the Union of Orphans diseases like bullous, petromolis, SMA, and other representatives of the heads of our organizations have something to do with the joint work with the Ministry of Health. And Natalia has mentioned that we are considering the packages of documents and we are studying whether these packages correspond to the criteria set in the regulation in the order and whether this or that institution actually corresponds to those requirements. Because before the war, we are developing the concept for establishing reference centers in Ukraine. That is something that we have in Europe, but unfortunately, we don't have it in Ukraine as such. We would like to have more of this system. And in spite of the war, we are taking the steps, we are moving on, not just in the front line, but also in healthcare. And we are cooperating closely with the physicians present here, and not only those who are present here now live, but those who are present here online. We are working with the ministry and all the stakeholders that can actually contribute to the improvement of the healthcare system in Ukraine in general. I would like to express my gratitude personally to you, Natalia, for finding some time to join us today. We all understand that you're very busy at the end of the year, and the load of the Ministry of Health is really high. You're doing great things, incredible things, and we hope that together we will manage to do what we want. So let's believe in that and let's move on. Thank you. So let's move on, and I would like to give the floor to Oksana Hulenko, who is the head of the Healthcare Standardization Unit from the State Enterprise State Expert Center of the Ministry of Health of Ukraine. And she will tell us more about the sectoral standards in healthcare in the cystic fibrosis direction. She will tell us what has been done and what we may expect in the nearest future. You're welcome.
Unfortunately, there is no sound. Perhaps you need to unmute yourself. All right. Can you hear me now? Good morning, dear colleagues. Thank you for the invitation to participate in your conference. It's the second time that I'm participating in a conference like that. I will not be having a presentation today. It will not be the same presentation that I delivered last time. I just want to provide an update about the state of affairs. I know that today we have representatives of other patient organizations for other orphan diseases, already mentioned by Larissa Voloshina, and thus, I want to tell you that the State Expert Center has been assigned as the main institution for development of sectoral standards, and we are doing methodological and information support for the work of interdisciplinary task forces. And all interdisciplinary task forces, the composition of which is approved by the orders of the Ministry of Health, are working according to the order of the Ministry of Health, which approves the methodology for the development of sectoral standards, which align with the requirements of the European community. Thus, our work on development of sectoral standards complies with the requirements of the European Union. It should be mentioned that the Ministry of Health pays detailed attention to unification of healthcare provided to patients with orphan diseases. As of today, and it has already been mentioned by the previous speakers, the Ministry of Health has approved an interdisciplinary task force for cystic fibrosis, for congenital hypothyreosis, and other orphan diseases. And we also have a group that will be working on the development of 15 sectoral standards that have to do uh, with the dietary disorders. And we are continuing our work. We have already developed draft documents. And if we are looking at the draft document pertaining to cystic fibrosis, we have taken into account the desires of patients' organizations, the scientists that presented during the previous conference in Ivano-Frankivsk in May, and we also took into account the additional recommendation with regards to dietology and nutrition. And the draft clinical guideline was also developed, and we also decided to take into account recommendations including indications and contraindications against transplantation. So all of these have been taken into account, and it should be mentioned that the draft documents, I mean the clinical guideline, which is evidence-based. On the basis of this guideline, the interdisciplinary task force has developed a healthcare standard, and currently we are at the final stage of developing this document. We are getting ready to send out this document for external review, and hopefully in late November, we will be able to have a public hearing, which will result in the approval by the Ministry of Health. When the documents will be published on the website of the Ministry of Health for public discussions, I'm inviting all of you, and we will be really grateful for your feedback. With regards to other nosologies, we are working with various degrees of success. Uh, we hope that with regards to other diseases, we will be able to reach the same level of success. And we hope that we will be able to submit the documents by the end of November. When developing the documents, we're taking into account the best recommendations, the best practices. We are not just stopping. We don't rely on one source alone. We are working with a number of sources. We take into account the best practices to develop our own standard, which will be binding under license agreements and accreditation requirements for healthcare institutions in Ukraine. I'm talking about all the different healthcare institutions of different form of ownership. What else should be mentioned? As Natalia Ostropolis mentioned, our previous speaker, in our standards, we indicate information about specialized healthcare that is to be provided at specialized reference center. This is a novelty. Of course, we indicate information about neonatal screening, which is a separate section of the standard. And do you know that in Ukraine, we have already introduced neonatal screening, including that for cystic fibrosis, and you know that early detection is really important. We shouldn't be waiting for the appearance of clinical symptoms, because this will result in better quality treatment and better life quality for our patients. Thus, in our documents, we are taking into account all the recent developments both in the world and in Ukraine. with regards to approval of other laws and regulations, and we are taking all of these into account in our standards. Perhaps some of you may have questions, because my role is to provide methodological and information support of work. So if you have any questions with regards to standards, I'm eager to answer them. So dear colleagues, do not hesitate and ask your questions. Oksana, there are no questions in the chat. Perhaps somebody in the audience has a question. I'm asking you to stay with us online, and in the meantime, I'd like to provide a short comment for our European colleagues. Why it's important for Ukraine to have these standards. Until Ukraine becomes an EU member, we cannot, in the legal dimension, follow the deadlines that we have in the EU, in the US, and in the UK, in other developed countries. Thus, we need to take the best documents, the most recent versions of what has been done in the developed countries, and adapt them to our conditions, to our context. And we can do quite a lot. We have successful cases of transplantation, we have successful cases of children being born, and hopefully today and tomorrow we will be discussing some new accessible therapy for our patients, which will allow to change the quality of life for patients with cystic fibrosis in Ukraine, despite the circumstances that we are all experiencing. And I would like to express my gratitude to you personally, Oksana, for the work that you are doing, because Oksana is now dealing with 120 areas. She needs to approve 120 areas, standards for 120 areas, and she is not working from 9 to 5, so she is working around the clock, and we are really grateful to you for finding a couple of minutes of your time to tell us about what is being done in Ukraine with regards to standardization of the most important documents, which will allow for us to work in the legal dimension, which will allow for the physicians to work. And it should also be mentioned, I want to mention this, that today in the audience we have physicians who are members of the task forces who are working with those most important documents, and I'm really grateful to Ludmila, to Natalia. I'm grateful to all of those who are watching us online, Katerina and Anna, because some 5 years ago I asked Katerina how Slovakia was able to have reference centers for cystic fibrosis, because we were discussing cystic fibrosis, and when together with the colleagues we were working on the very concept of having such a system in Ukraine. I really liked it, how Slovakia worked in this direction, because Katerina told me that they were focusing on those institutions that were providing healthcare to 50 patients and more. And those institutions became centers, so they were better equipped so that patients could indeed get the best healthcare in Slovakia. And honestly speaking, you are an example for us, and hopefully in Ukraine, despite the war, we will be able to achieve this result. We've already made some progress, and I think that we will have the best positive results for our patients. Thanks a lot, Oksana. While we don't have any questions, perhaps we get any throughout the day, I will send them to you, and then tomorrow morning I will read the answers. Thank you, and goodbye. Right now, we are going to have a Q&A session. We have 20 minutes for the Q&A session. So should you have any questions, please don't hesitate and ask. It's the purpose of today's meeting to have a discussion, to clarify things. Perhaps you have recommendations or there are things that you would like to express. And perhaps you have some suggestions. We want for this conference not just to be theoretical, we want for it to be practical. We want for it to have a practical impact on our life in Ukraine. Good morning. I have a question. So my question is about the reference centers. Can the children from across Ukraine get treatment at the reference centers, or do these centers provide their services to specific regions only? It is our view for the future that such reference centers will be providing qualified inpatient and outpatient treatment. But with regards to supplies of medicines, this will be the burden for the budget of your region. So the doctors working at reference centers will be able to provide assistance. They will be able to treat both adults and children, but with regards to medicines, you will need to work within your regions so that you can come to the reference centers with the medications that you need for your treatment. Tatiana, the microphone is being delivered to you. Good morning. Let me add a comment to what Larissa has mentioned. Just the accredited reference centers will be able to provide recommendations with regards to your treatment. It cannot be done by just a doctor that you know, by your polyclinics where you get consultation. So it will be done only by the reference centers. And whether it's patient from the west of the country or east of the country, it doesn't matter because orphanage will help us get the coding for the patients. I will tell you a little bit more about that during my own speech, but it's for patients from all across Ukraine. Anyone can come to the reference center. Good morning, I'm Yuri Ozarevich. I'm going to have a speech a little bit later, and I have a question not for Larissa, but for Natalia Ostropolaits from the Ministry of Health. So the question is about the reference center, and we were discussing reference centers, and probably we need to discuss packages of treatment for patients with cystic fibrosis or other orphan diseases. But when we are talking about adults and children with orphan diseases, they require more extended treatment, and sometimes the treatment packages do not cover those needs. And we had a debate with the Ministry of Health, with the National Health Service of Ukraine, to maybe have some separate packages for patients with orphan diseases, because when we were having discussions with the local authorities about creating such centers, they realized that having such centers that would be funded from the general budget, and we realized that such patients require additional treatment, additional examinations, and their packages should be more extended. The inpatient treatment lasts for a longer time. So it's a question to all of you. How does the Ministry of Health see this? Should we have separate packages maybe, or should we have an increased coefficient for funding the treatment of patients with orphan diseases? So I will start answering, and then Tatiana Kulesha, who is head of the NGO Orphan Diseases of Ukraine, will add some comments. So we've had a discussion like this one with colleagues on a number of occasions, and we were saying that during this year and hopefully before we reach a specific result, we will be able to have such negotiations in the next year. So we were saying that reference centers will be approved. The interdisciplinary task force will be approved by the Ministry of Health, and we are submitting the data to the National Health Service of Ukraine so that all the physicians that are members of the interdisciplinary center, reference centers in Ukraine, could get an additional coefficient for each patient that they are treating. In such a way, we will provide an incentive to the physicians, we will support their community, and number two, this will result in a more efficient treatment. Perhaps Tatiana would like to add something. Yes, I have a question for Oksana. Is Oksana still with us? Oksana from the State Expert Center. So let me answer this question. It's a really complicated question. We understand there will be no separate package for orphan diseases, at least in the near future. We have 7,000 patients with orphan diseases in Ukraine, and it's really difficult to develop packages for them because the entire budget of the National Health Service of Ukraine will be spent on that. So we've already had a number of meetings with Oksana, and hopefully we'll have more in the future. So we hope for those orphan disease centers treatment that will be approved to have a higher coefficient for the doctors. Yes, of course, it's our wish to have something that people have in Europe, but that's just a dream at the moment. What we can do is to provide incentives to the physicians. And Yuri, we will be grateful to you for any of your contribution. Yes, of course, for doctors treating cardiovascular diseases, they have such coefficients. And it's working, and we were trying to transplant this to orphan diseases, and the doctors working with orphan diseases, but we shall see. For the time being, we have no idea how to pay for the services of such reference centers that are functioning by the Academy of Sciences. Perhaps you can express your ideas about that. Yes, but could you please use the mic because it's impossible to hear what you're saying. My personal view is that all of these institutes should become part of the healthcare system and they should not receive additional funding. But there is an advantage for such institutes because they have their separate budgets, and if they have good managers, they can channel those budgets towards doing good things. Yes, they can get some additional funding if they are institutes, but my view is that they need to work in the same system so that everybody can have a diligent payment from the National Health Service of Ukraine. If we were discussing packages for orphan diseases, and maybe some people are claiming that this is just an excuse for the Ministry of Health, they may say that it will take a lot of time and every nosology requires its special treatment, but if a patient has been acknowledged as a patient with an orphan disease and the doctor will be paid more for treating such a patient, there will be more incentives to create such reference centers. In our regions, we were having such discussions for a long time, and to provide incentives to the manager of a healthcare institution is really difficult because they say we create this center, we will get the patients, but we will not be able to maintain such a center using the funds coming from the budget. And understanding such risks, nobody is eager to create such centers. So we are not talking about competition here. Thus we are creating such institutes, and the patients go to such institutes. Yes, it's an open question where we are moving, and of course there are many questions pertaining to the orphan diseases. There are different orphan diseases, and the treatment prices vary. So cystic fibrosis is probably the most common of the orphan diseases. Some people say that cystic fibrosis should be a separate orphan disease. The others claim that maybe it can be put together in a group with a different orphan disease. So if I may, I'd like to comment briefly. Since we are being watched online, both in Ukrainian and in English, I would like to clarify the situation for our colleagues from developed countries who have already completed this journey. But we can say that at the moment in Ukraine, before the war and even now, we are having physicians, we are having hospitals where people with a cystic fibrosis receive treatment, both and adults and children. But before 2023, we did not have a single center acknowledged by the Ministry of Health or the Ministry of Justice as a center for treatment of orphan diseases. And it's important that we have such centers because otherwise we will be unable to move forward to get to the next level. It's important that we do everything possible to create this internal network in Ukraine so that we can look at the geography, how many regions could be covered by one reference center. And we need to focus our attention not on all 24 regions, but we need to focus our attention on those who want to study, who wants to learn, who wants to see successfully treated adults and children. Those who want to do things that seem impossible, but sometimes we need to take risks. Sometimes we need to speak up instead of staying silent. And my vision as a representative of a patients organization, we need to create conditions that would help us build this network first in Ukraine, and then we can seek cooperation with similar centers in Europe, and we are already working towards this goal, and we will be working in the near future. Maybe our friends from Slovakia, our friends from the European Cystic Fibrosis Association will be telling you about this. So even though the reference centers have been acknowledged and approved, we only have 3 institutions that signed agreements. So these are 3 institutions that will be working with Israel, France, and the UK in order to exchange experience, in order to find some common solutions. Without that, we cannot be moving forward. And since I have a degree in psychology, I want to tell you that there is no other way for us. We can either move forward or we can move back or we can just stand still and do nothing. But there will be no progress coming from that if we don't move forward, if we stand still. Despite the complicated situation, I see it necessary to move forward, regardless of how difficult it may be. But we need to find the strength, and I hope that tomorrow I will help you find your own internal resources, how we can do that where we are in order to improve the situation in healthcare in general, in cystic fibrosis treatment, in your personal and professional lives, and of course for all of us to help contribute to our victory. We still have some time left for the Q&A session. So please, you're welcome. All right then, while our next speaker is joining us, I want to tell you a little bit about the funding that we have in Ukraine for getting essential medicines. This will be part of my own presentation, but for me not to take time away from my presentation, I'm going to tell this information to you now. So let me tell you that in Ukraine, on the state level, we don't have any insurance healthcare. So you don't have healthcare insurance on the national level as such. But we have a law which stipulates for the provision of essential medicines necessary to treat patients with orphan diseases. And we mean patients who are citizens of Ukraine, both adults and children. And it's a separate component that is overseen by the Ministry of Health. So they calculate the need, and every year we submit reports on the needs of adults and children. And with regards to cystic fibrosis, inclusion into state funding on the national level applies just to 4 medicines: creon, colomicin, because you can start administering it once the patient has reached 1 year old, and hopefully we will be able to include inhaled tubramycin in the near future. Why are we sometimes asked by European colleagues, why is the situation like this? Why do some regions submit their need for humanitarian aid while others do not? So some regions lack just one medicine while the others lack more, or they don't lack anything, in particular during the war. So let me explain. Since we have the law on decentralization in Ukraine, money stays in the region. So the regional authorities manage the budget, and according to this law, covering the needs of patients residing in a specific region uh, is done with the help of funds coming from regional budgets. And here we need to work and cooperate. So you need to cooperate with your regional departments of healthcare, with deputies, with people who decide on treatments for adults and children, because the situation is really uneven if we compare inpatient treatments in different regions. And we were discussing this for a while now. We've been discussing this for a while now. And the life of our children, the life of all the people with cystic fibrosis depends on what we are doing. So we are talking about the lives of people in different regions and across the country, because the things that will be created by us now will have a direct influence on whether people with cystic fibrosis will return to Ukraine after the war is over. It appears that our next speaker is already online, and this is Deputy General Manager for Client Service and International Relations, Katerina Nekrasova, who will tell us about provision of people with cystic fibrosis with medicines in Ukraine through the prism of the activities of the State Enterprise Medical Procurement of Ukraine. Good morning, dear colleagues. Thank you for the invitation. Thank you for giving me the floor to tell you about the activities of medical procurement of Ukraine. Will you please tell me whether you can see my presentation on screen? Yes, we can see it. Great, thank you. So we can start then. At the very beginning, I'd like to say a couple of words about the areas in which state medical procurement of Ukraine is working. It's not just about centralized procurement, as been mentioned by Larissa. We are also working as a procurement agency, and we are part of the United 24 initiative of the President of Ukraine. So we are a procurement agency within this initiative, and we are also helping in development of decisions for the state and citizens to ensure enhanced transparency of all the processes of supplies of medicine. So we have the software which is MedData and eStock. So I hope the majority of you have already heard about them. So we are talking about administering of medical catalogs in Prozoro market. So the Ministry of Health is doing the qualification of products, and uh, the customers just put their demand and they wait for the agreement to be signed. And we are providing services to other customers. But coming back to ensuring the function of centralized procurement of medicines for patients with cystic fibrosis. So here on this slide, you can see an approximate flow of how the process looks like. So we were created by the Ministry of Health of Ukraine. We work in close cooperation with the Ministry of Health. And here on this slide, those highlighted are our main areas of expertise. So number one is creation of nomenclature. Creation of nomenclature, that's the responsibility of the Ministry of Health, because when our enterprise was created, one of the main tasks was to separate the institution that is the policymaker and decides what needs to be procured, and to have a separate institution that would deal with the procurement. So step number one is deciding on the nomenclature, and that's the function of the Ministry of Health. So as of today, nomenclature under a centralized program is permanent, and if we are talking about the nomenclature for the treatment of patients with cystic fibrosis, it's also steady, so it has 5 items. Step number two after deciding on nomenclature is collection and verification of demand, and here we cooperate with the Ministry of Health, because on the one hand, collection and verification of demand is done via instruments that are administered by us, that is MedData and eStock. But after the information has been aggregated, once we've collected information from the regions, verification of need is done both by us and the Ministry of Health. It should also be mentioned that demand collection in this area has a methodology that was developed by the Ministry of Health of Ukraine, and it takes into account the medicine, uh, the disease, and the patient, and there is a specified dosage of medicine that can be ordered for this specific patient. Of course, we understand that there may be some divergences based on specific prescriptions, but by default, we follow the methodology approved by the ministry, and normally we validate the submitted demand using this methodology. Upon collection and verification of the need, both done by the ministry and us, we launch the process of approving the passports of budget programs and quantities. During the demand collection stage, we don't really have a clear understanding about the budget funds that can be allocated to cover this specific area. Thus, again, approval of the quantities happens by the Ministry of Health once the ministry realizes how much money can be allocated for centralized procurement. Upon approval of quantities, we proceed to forming of terms of references. If we are talking about medicines, uh, as of today, we are not actually cooperating with experts from the Ministry of Health, but if we are talking about a specific disease, the instructions for medicines need to be detailed so that we can avoid off-record use. So we include this notice and we require it from all of the suppliers. Upon finalizing of the terms of reference or requirements, in other words, we proceed to procurement, which you can track in Prozoro, and then we proceed to supplies and quality control. The medicines are delivered to warehouses, and all the medicines undergo incoming quality control, and should there be any divergencies from quality levels, medicines can even be sent to lab control, and once we've received a conclusion from the lab, then we can either receive such medicines or destroy them. But in our experience, we haven't had any negative cases. The majority, all the medicines that we receive are later distributed between the regions, and shipment of medicines to regions is the final step in centralized procurement of medicines for patients with cystic fibrosis. If we are being more detailed about uh, collection of the demand in this area, then this year we started collecting the demand really early. We started doing it in August of 2023, and it was practically the first year when the demand was collected not on the level of regions or Department of Healthcare, but on the level of healthcare institutions. And if we are talking about healthcare institutions, we understand that we have a coordination with the National Health Service of Ukraine to understand which particular institutions have packages from NHSU for treatment of such diseases. So together with NHSU, we compile a list of institutions that have submitted their demand. But of course, we are always eager to listen to feedback. As of today, we are at the final stage of collecting the demand. We are talking about the demand for the year 2024. There are some issues that we need to tackle with two regions, but we hope we will be able to sort them out in the near future. And from our side, it should be mentioned that since we collect demand per patient, it appears that the number of patients has decreased by a little bit over than 15%, but if we are talking about specific medicines, then we can see a trend for the increase of demand. So hopefully in the near future, we will finalize the demand collection for this area, and we can proceed to verification of that demand. And it should be mentioned that when healthcare institutions submit their demand, it's verified by the Department of Healthcare. And when the demand is submitted, we don't have ideas as of now about the budget sums allocated to cover this need. So we don't know whether the need submitted will be 100% covered by the budget funds. But of course, we will have information about the specific amount allocated from the budget. We will have that information in the first quarter of 2024 once we get the feedback from the Ministry of Health. But we can definitely tell you that in view of the fact that procurement of medicines for the treatment of cystic fibrosis have been we were conducting such procurement since 2021, so we already know the market, and we hope that we will be able to cover this need really expediently. And with regards to centralized procurement using budget funds of 2023, so as of today, out of the entire nomenclature, and we are talking not just about medicines for treatment of cystic fibrosis, it's also about medicines necessary for treatment of cancer and also treatment of other orphan diseases. So we can say that we have already procured 91.7% of goods. So if we break it down into areas, so the sum total allocated by the state is 151 million hryvnias, and out of 151 million, almost items for the sum of almost 150 million have been delivered to warehouses. So we are saying that the medicines that were procured in 2023, that were contracted in 2023, but we are still in 2023, it's not the end of the year yet. So we were able to achieve such positive results because demand collection for 2023 started early, and we are grateful to everyone who proactively responds to our requests. And we are grateful to you for responding to our letters. Right now, we are at the stage of delivering medicines to region. We have already delivered goods for the sum of 14.8 million hryvnias to regions, but we are still delivering the items. But almost all the items that have been contracted have been already supplied. This tells us that our patients will be supplied with necessary medicines. And if we are talking about provision of medicines, we understand that it's important not just to procure and deliver medicines, but also to inform people as to where they can find them, where the patient or the physician can find them, because even if there's a lack of a specific medicine in a specific region or a healthcare facility, we always have the option of redistribution. And with that very purpose, you can use two resources, our Telegram chat or our Information BI platform. So on the screen you can see links to the two resources which have been created so that the people who have a demand, people who have an understanding of how procurement works could just go to either of the two and get necessary information. And we as an organization would like to say that unfortunately we sometimes are faced with a situation when we have remaining stocks appearing in the system, but patients find it that there is no remaining stock in the hospital, unfortunately. You need to understand that the resources are just aggregators of information that we receive from healthcare institutions. That is why we are urging the healthcare institutions to provide information every 2 weeks, because this is the information that their patients will be able to use in the future. It's also information that may be useful for the physicians if they need to refer their patients, or this information is also used if there's a need for redistribution. It gives us a better understanding as to where we can find the necessary medicines, because these are the medicines that are supplied to our patients free of charge. So if we check the information on the two resources, you need to keep it in mind that these are just aggregators, and we are doing our best to make it more convenient for the healthcare institutions to provide this information to us. But there's always the human factor when somebody is late on submitting the remaining stock, and then we need to have a clear understanding that in a situation like that, it needs to be a separate line of communication with that specific healthcare institution or facility. And from our side, we always try to respond quickly, and when our bot receives information that there is actually no remaining stock which is displayed in our system, so it's just a sign for us to contact that healthcare facilities and ask them to update the information. But these tools help us to get an understanding about the medicines that our patients with cystic fibrosis can get free of charge, and it can also give us an understanding as to how the medicines can be redistributed. At the beginning of the full-scale invasion, unfortunately, we faced a situation when people were either forced or willingly relocated to the west of the country, and at the time, state logistics was focused on reinforcing the western regions with specific medicines. But today, we already have an understanding about consumption trades in specific regions. We have a patient-oriented distribution per region, and we try to have a more even distribution across the territory of Ukraine to have a more even coverage both across the country and within a specific region. In summary, since 2021, Medical Procurement of Ukraine started procuring medicines for treatment of cystic fibrosis, and we have already developed some procurement strategies. And in 2023, for the first time ever, we started collecting demand on the level of healthcare institutions, and we hope that this particular step will promote a better submission of demand that is being collected on the level of patients, because the state ensured centralized procurement of medicines for these patients. And if we are talking about 2024, we are at the final stage of demand collection. We will be able to inform you about the specific budget allocations in the first quarter of 2024, but the trend is already there. In 2021, we started with a general sum of 105 or 110 million, and now you can see that there is a tendency for the increase of this sum, which is of course stipulated by importing some of the medicines that are procured by the state. But at the same time, this trend tells us that the patients who receive treatment need to continue this treatment, and the two resources, the two bots are a tool for the patients and doctors to get information about remaining stock, about the medicines that are being procured, about the status of the procurement, and they can understand whether the state even plans to procure this or that medicine. So, of course, we understand that not all medicines are covered by state procurement programs, but the sum that I've mentioned is already a huge step forward. From our side, that's all that I wanted to tell you. Thank you for the invitation. Should you have any questions about centralized procurement, about the procedures, feel free to ask them. Thank you, Katerina. Thank you very much. Let us see whether we have any questions from the audience based on the topic of your presentation. If you have time, please stay with us online for a couple of minutes. I would personally like to thank Medical Procurement of Ukraine for all the work done by them, because this institution does respond to our requests really quickly, and we are having close cooperation with your colleagues, with your team, and pass our regards to your colleagues. Thanks for all your work, because we indeed received fast responses with regards to a specific region. I will not be telling you the entire story, but your organization provided information within 30 minutes. That was information about a specific region. So allegedly, the medicine was not available in that region, but we knew that the medicine was supposed to be available. For our friends watching us online, I want to say that when the war broke out, we can already say this, the main warehouse of all the medicines, which was situated near Kyiv, where active hostilities were taking place. The region was hit by missiles, and thus, unfortunately, some medicines were destroyed completely, and until February the 24th of the previous year, we were unable to deliver the medicines to all the people. And on the 28th of February, I asked my colleagues from European countries to join in on the help to Ukrainians with at least Creon, these most simple medicines, because the entire Ukraine had no Creon. We were trying to share, we asked our colleagues, we practically paid no attention to expiry dates. It was important for us to save our patients, and then with time, when we were able to find some medicines that could be salvaged, we were trying to think about ways of redistributing such medicines within Ukraine, within the conditions that we had, under conditions that we had.
So thank you. And dear audience, dear participants, do you have any questions to Katerina? Katerina, there are no questions. So we will definitely once again send the link to the chat bot where everyone interested in the quality, in the quantity of drugs that have entered a certain region where institutions have access to those medicines available. So we will publish this information once again, and we are really grateful to you for for the work you're doing. Glory to Ukraine, glory to heroes, and thank you, Larissa. On behalf of the Medical Procurement of Ukraine, I would like to express our gratitude to you for your standpoint for close cooperation, because public-private cooperation or cooperation of the state sector with the public sector is something that can provide patients with more efficient access to what they by default are supposed to have at the level of the state. So thanks a lot, and we really hope that we will closely cooperate in the future as well. Thank you. Now I would like to invite our friends, my most close friends. Friends are always near me. They have been always near me since the day I started representing the Ukrainian Association. That happened in 2015 when I became the president of the All-Ukrainian Association. And these are my colleagues with whom we are moving forward in spite of the war. We are doing incredible things at the state level. So the head of the Orphan Association, Tatiana Kulesha, the director of the Charitable Foundation, the Finance Initiative, Tatiana Mikhailova, the head of the NGO dealing with phenylketonuria, Vladimir Tutuk, and head of the NGO dealing with pulmonary hypertension, Oksana Alexandrova. I'm really happy to see you, dear colleagues. On our part, we would like to congratulate you because that is a very important day, and we ourselves are organizing some conferences. We know that this work is very important for patients, for everyone who is present here. This is a great event. We know how much work you did to organize it. It's important to really establish interaction, cooperation between patients, patient organizations, physicians, and the state sector. It's really important, an important step, so congratulations. So today we're looking for this bouquet in the colors of cystic fibrosis with cotton. Um, so can we be standing or do we need to take our seats? Okay, so let's take our seats if that's necessary. So good afternoon. I'm Tatiana Kulash. I'm the head of the NGO Orphan Diseases of Ukraine, and as Larissa has mentioned, I don't know where the border is between friendship and work. There is no border because the history of my meeting Larissa was a unique story. We didn't understand actually how we are supposed to cooperate, but we started this cooperation, and now what we have is substantial cooperation. And Larissa and her colleagues are really working a lot. They are providing for the rights and advocating for the rights of patients with cystic fibrosis. We are proud of that, but we are also proud of the fact that thanks to our cooperation with Larissa and all our colleagues are working with us together, but only some of us have arrived here. But I'm really proud of the fact that the State Expert Center, the Ministry of Health, are now talking about the policy of orphan diseases. Let's be frank, 10 years ago, all those officials didn't use the word orphan, but organ diseases. They didn't know what this notion was about, and they didn't want to do anything about orphan diseases. So today I'm proud of the fact that our work together with the colleagues has been transformed into the policy, large-scale policy of the Ministry of Health and other state institutions, which aims at providing assistance to people with different orphan diseases, not only cystic fibrosis. We understand that our work can be done in different directions. Each organization is doing what it can, but the overall policy of the state is something that should be the general state policy as in any European member state. It needs to provide for all our patients to take care of them. So I'm proud of cooperating with Larissa and all of those of you who are in the regions and the physicians who are in the room now. I'm really bowing low to you for what you do, for you working with those patients. I keep writing that you are heroes. You are really heroes. Ukrainian physicians are really heroes. We attend a lot of conferences and we don't have such dedicated physicians as we have in Ukraine throughout the world. So I'm really bowing low to you for all you do for people with CF and for other ones as well. But today we're talking about cystic fibrosis. The other thing I would like to mention is a rather global statement because the policy everybody keeps discussing today is being written by us on a daily basis throughout disputes in our offices. We work a lot and we never talk about that. And the Ministry of Health and the State Expert Center already gets the ready-made documents of showing what this policy of orphan diseases should look like in Ukraine. And I do believe that when Ukraine becomes a member of the EU, we will already have everything complying with the European standards. I really truly believe in that because we are all working at that. As far as the NGO is concerned, we have come here with a large presentation, but I don't think that we should show this presentation. Let me just tell a couple of words to patients, because we have got two large-scale organizations that support all orphan diseases. This is the Charitable Foundation, my colleague Tatiana will tell about, and the NGO. And as far as the NGO is concerned, we've got two major programs that support all orphan patients. So the first one is the program for transportation payment of the tickets, buying of the tickets for all the patients who are relocated from one hospital to the other hospital in Ukraine. We have a specialized questionnaire, and if you don't have access to it, Larissa can send it to you. We are ready to cover the cost of transportation of all patients when they go to have some examination diagnostics in other regions in their hospitals, and we have a special questionnaire for humanitarian aid provision to all patients. So patients need to fill out the questionnaire, and that is not related to expensive drugs. That refers more to the needs that we've currently got, like consumables, like pills, clothes, sometimes food, syringes. So Larissa has got the link to that questionnaire. If you need, please fill out the questionnaires. We will consider them, and in most cases, we will meet all those applications that we get. And probably the last thing to be mentioned is that war is a terrible thing, as mentioned today already, but on the other hand, it crystallizes both the worst and the best things. And I'm sure that this period has clearly shown to us who is who should be close to us, who needs to work in what way, and who is worth something. No details, but I think that we all know what I'm talking about. So thank you, Larissa, for staying with us for several years together. We have common vision. Thank you, and thank you, team. I really love you.
Thank you, Tatiana.
Uh, I would like to stress that really starting with 2014, we covered we have covered a long path, and we have introduced major changes for all patients to have their treatment. And today, these patients really have high quality treatment in Ukraine, and it's pointless to go abroad and to be looking for some other treatment abroad. But I would also like to mention that besides this fight, each of you is covering your own path of your own fight that starts with the point in time when the doctor tells you what the diagnosis of your child or what your own diagnosis is. And then this path you cover deals with the realization of the fact that your life has changed since that from that moment on, and the way you start fighting for the life of your relatives or the people who are near and dear to you. This is a heroic path, and I'm really grateful to you for what you are doing, and I would ask you to share this experience. For example, I'm really proud of being acquainted with the mother of one of your patients, Yaroslav Spichak, who, well, probably a lot of you have heard about him. That is the patient who is unfortunately no longer with us. But the mother keeps fighting. She has established the foundation with a very nice name, and you know, the cystic fibrosis can be also called cystic fibrosis. It's something close to what this name looks like in the English language. So she has established a foundation with this name. And I'm going to tell you about the experience of our colleagues from the European Association of Pulmonary Hypertension. They have launched experience exchange called More Than a Disease. In our case, more than pulmonary hypertension, but that refers to every single orphan disease. And within this experience exchange, people tell how the disease has changed their life, and how, in spite of the fact that they are on the edge, they are opening up some new opportunities for themselves. Some of them start writing books, some of them start doing something else. Suppose a patient from Norway became the chess champion in Norway because these people cannot be very active, but they can open up new horizons for themselves anytime. that is really inspiring for those who have just learned about their diagnosis. And they learn how to move on, how to live on. So I would wish you never to give up. Please keep fighting and keep fighting with a smile on your face and let you live the happy days of your life. Well, I'm still struggling with my Ukrainian. Sorry for that. So let each day of your life and of the lives of your relatives be full of happiness and the warmness of your friends' palms. Thank you. Dear participants of the conference, on behalf of the Charitable Foundation Orphanis Sanitio, let me welcome you on the occasion of this important event, conference, which, in spite of all the challenges and threats of the war, is taking place now, today, in Ukraine, in this beautiful and brave city of Lviv. And it is being held by the All-Ukrainian Association of Care of Patients with Cystic Fibrosis, and also thanks to our heroic defenders, the armed forces of Ukraine, where we have the relatives, the husband of Tatiana Kulesha and the daughter of Larisa Voloshina. Thanks to the association, as mentioned by Tatiana, since 2014, we have been fighting for the rights of patients with cystic fibrosis to high quality and highly professional health care. And the association functioned before the war, it keeps functioning now, in cooperation with other associations, with the state authorities, and with physicians. Our foundation, after the beginning of the war, supported the project of the association, which are humanitarian projects aimed at provision of meeting of the critical needs of patients after the beginning of the war. I'm talking here about the patients affected by the war, and also our foundation has supported a very important project dealing with the genetic diagnostics of patients with cystic fibrosis, the results of which identify the opportunities for applying new Trikafta therapy, which radically changes the life and the health of those patients. And our foundation has also supported this conference, because this is not just a scientific and practical event. This is about the voice of the community, the ability to hear the voice of the patient community in the conditions of war. And here we can hear what assistance is to be provided to the patient community now and after the victory of Ukraine. And let me add that this support has come to be possible thanks to the grants that were provided to our foundation due to the war by international organizations, Global Giving and Global Genes. So we are really grateful to those organizations for their support and for the support of orphan patients in Ukraine. Thank you. Colleagues, thanks a lot for your warm words, for your kind words. I will have a report after lunch and in my presentation I will show you what we have done over the year, what grants we have won, what we have implemented, what we still have uncovered, unmet, and what the money is primarily focused on. And I'm really grateful to each of you for your daily work in respect to conveying the messages about our problems and changing the lives, because life in our country depends on each of us as an individual, as a Ukrainian. So I'm more than convinced that only together, only by joint effort and joint actions, and only by going through the difficult stages in our life, that we can reach success. Yeah, I've understood that you are kind of wrapping up, but let me also tell a couple of words. You know, it's very good when all parents come together, because you know this, and I would like to also focus on this, that Each orphan patient in the world is supported by his parents, and it is thanks to the parents that each orphan patient has an opportunity to live on, because orphan diseases are incurable and lifelong diseases. And the same is the situation in Ukraine. Thanks to such parents like Larissa Voloshina, Tatiana Kulesha, and many other organizations, that the children have got treatment, they can live on, they can achieve something. So please value each other, love each other, respect each other. And also respect the head of your organization, because it's really true to have that it's important to have such an organization. If parents provide their support, it's very good. You address each other, but anyway, finally, it will be the head of the organization that will become responsible for solving of the problems that you are raising. We cannot move backwards because children are behind us. We can move only forward. Thank you. Colleagues, I would like to tell a couple of words. To be more specific, I would like to say that probably each of us sometimes has a point in time, a moment in his life when something special happens, and you come to realize that first you are in the state of apathy, you don't know how to move on, where to direct your energy, knowledge, power. Maybe you're going to fail. That's what you feel. And I think that we will hear from Katarina and from Pavel about that, and I'm sure that each of you can also tell about this. Everyone can, each of you can tell us that those who are here in the stage or in this room did not learn how to have the negotiations with yourself, how to develop an NGO, how to develop an association. Nobody taught us to do this. It was ourselves who heard this strong point inside us that kept inspiring us. Primarily, I'm talking about our children, about our patients, people with orphan diseases, and the main thing is that only by realizing that when you set the goal to do it for everyone, then at least your child will definitely get this treatment and not vice versa. Your child should not be prioritized. You should set the goal to cover everyone, and then there will be some achievements. And I'm sure that such achievements have already taken place with each of us. And I would also like to say that I'm grateful to my life for by having this honor and pleasure to represent people with cystic fibrosis in Ukraine, that I have the pleasure of cooperating with such great colleagues. I'm really grateful to you. And finally, let me say that now we're going to have lunch and we are getting back to our broadcast. Let me check it. At 1:45. So please don't be late. And see you after lunch. Thank you.
have cities that are a little bit safer, like Lviv is, and hopefully we will be able to have our conference without breaks, without any air raid alerts, so that we can discuss the important things. Before I start my presentation, before I present my report on the achievements of the previous year, I would like to tell you about some important things which have to do with our families and friends. There is probably no family in Ukraine that has not been affected by this war, that doesn't have somebody serving in the armed forces. It may be a daughter, it may be your son, it may be your husband, wife. But I'm more than sure that in conversations with people from our community and outside of our community, I'm sure that every family has a member who is currently serving in the armed forces, protecting our sky, protecting our land, and allowing for us to have conferences like this one. I want to tell you about some important things which have to do with free of charge psychological support for all families, including families of our servicemen and their family members. As a psychologist, I'm now working as a volunteer for an NGO. It's worth living, and within our NGO, we are providing psychological support to everybody who's in need of it. And before my speech, before I start delivering my speech, I want to tell you that this platform is free of charge for every Ukrainian, for every woman, for every child, for every serviceman, for everyone who wants or has the need to support their mental health. This is really important for us, and it will be important for many years to come. So I'm inviting you to watch a short video about what we are doing in Ukraine for Ukrainians. Being afraid is normal, feeling fear is normal. I think that we all need emergency psychological support, and I believe that mental health is no less important than the physical health. All these feelings that we are currently experiencing are normal because we are living in a state of war. Feeling anger is normal. Not understanding what's happening inside of you is also normal. And we need to talk about these things. We need to get it out, it's very important. We are living in a state of war and it's scary. If you need psychological support, feel free to approach us. Please make a call because it's normal to talk to someone who you don't see face to face. You can hear their voice on the other side of the line. It can be useful. There is somebody who is going to listen to you, so please call. Feeling calm for the sake of victory. Let me tell you once again that this is a free of charge service. It's a free helpline, so you can call every day between 11 a.m. and 7 p.m. but on the weekend. So if you feel anxiety, if you have insomnia or any other disorders, if you have eating disorders, we also know that when we're feeling nervous or anxious, our body may have different responses. So please don't be shy. Forward this information to your friends and colleagues. It's a short number 5522. Our professionals are always eager to provide you with the professional support needed. So, in continuation, I would like to present the results of our work in 2023. And in making this summary, I will gradually tell you more about the activities of our organization over the period of full-scale war. Here on this slide, I wanted to show you to the left. You can see this bright colored map, 24 regions of Ukraine, including Crimea. And on this very map, we can see our neighboring countries. Before the 24th of February, we were planning for our future. We were hoping to have a summer. We knew that we could have a family vacation somewhere. But the 24th of February of 2022 changed our lives drastically. All our lives were changed. We all experienced immense shock, surprise, helplessness. So we had really different responses during the initial hours of missile attacks. But it gave us an opportunity to become closer, to get together, to do the work that we are currently doing. On the map to the left, you can see Ukraine as of the 1st of November of this year. Marked green are the territories that have been liberated from the Russian occupiers, from our enemy. And unfortunately, we still have quite a big share of our territory where it's really dangerous, where hostilities are taking place, where we are losing our young servicemen. But despite all of that, we continue our work, and I want to remind you, and I mentioned this in May during the conference in Ivano-Frankivsk, that when the war started, the first people who started calling us were just people who we had no contact with, or maybe we just had forgotten about them, but the people offered their help. I'm really grateful to Pavel and Katarina, who also sent a message to us asking where we are, telling us that we could come to their countries, but we realized that we needed to do something. I personally have children. I have an elderly mother. I have patients here in Ukraine. And at that time, the patients were in more serious, in more drastic situation. We had patients in Luhansk region that was destroyed by missiles, by shelling, and we needed to think immediately how we could help such patients. On the 28th of February, we already held a Zoom conference together with Yulia. And Yulia, at the time, was staying in the underground. Together with her daughter, she was staying in the underground. They were just coming out for a couple of hours for inhalation. So it wasn't easy for all of us. My daughter and my family, we all took shelter. We know what the conditions of those bomb shelters were. Those were just residential buildings. So those were actually basements of those buildings where the quality of the air was not the best. So we realized that our patients really needed inhale therapy because it's essential for their life. Our patients cannot live without Creon. There are some things that may be postponed, but life-saving therapy was a must. So we had a meeting during which we made some important decisions. Number one, starting from the 28th of February, in less than a week since the beginning of the full-scale invasion, we organized two hubs. One of them in Lviv, and I'm grateful to Helena Maku, who provided us with necessary facilities. So it was a storage facility where we could just keep the things that we were receiving from donors, from our friends. And we also have our friends from Rivne here, Yura, and the second Yura, and also Yulia. who helped us by again providing facilities free of charge to save our patients. And we were thinking about the way to move forward because we had a lot of patients that we needed to help. So we thought that Lviv could send the aid via Nova Poshta, that's a Ukrainian postal service. So we could use Nova Poshta services to other regions of Ukraine. And the guys who cooperated with international organizations, including the Red Cross, they risked their lives trying to evacuate people from under missile attacks and shelling. And they were also delivering the humanitarian aid. And the last regions to receive just about anything that we could provide to them were Cherkasy, in Chernivtsi, and Kirovograd regions because they were the safest at the time in Ukraine. I'm going to tell you very briefly about this slide. Before lunch, I told you that we don't have insurance healthcare in Ukraine. We have centralized procurement. That's the mandate of the Ministry of Health of Ukraine. So we have two medicines, two type of Creon and colistin among them. The other procurement happens on the level of the regions. We have the law of Ukraine on decentralization, and pursuant to this law, a lion's share of the budget stays in the region. Thus, we have a various level of supplies uh, depending on the region. So in some regions, there are municipal programs. For example, the city decided to develop a program to support covering the needs of different nosologies. It may be multiple nosologies, it may be one, maybe 3, 15. That all depends on the local officials. And of course, it all depends on how proactive the parents are. And we are trying to raise awareness and also stress that people should not be afraid of officials. It's okay to approach officials because they are regular people just like we are. They have the same head, legs, and arms as we have. Don't be afraid of telling them things that may not be really nice, but at the same time, we are acting according to the law, and we are one of the few countries that has a law on protection of patients with orphan diseases. And this law is supposed to regulate the supply of medicines to patients with orphan diseases, and I'm really grateful to Tetiana Kulesha, head of the NGO Orphan Diseases in Ukraine, who has been advocating for the adoption of this law since 2014. And we also have a decree of the Cabinet of Ministers of Ukraine 1303. It's the law on free of charge prescriptions. So a doctor makes a diagnosis and writes a prescription, and with that prescription, a patient may come to a pharmacy and get some medicines free of charge. But there is a big but here. We are discussing these things, but hopefully in the near future, the ministry and all the other decision makers will take into account another decree on the retail and wholesale prices. According to the law, a patient is supposed to get free of charge medicines, so they have the prescription, and according to the decree I just mentioned, they are entitled to getting that medicines free of charge. But the Ministry of Health registers one price for the medicine, and a pharmacy has a different retail price for that same medicine. And local authorities sometimes cannot find a mechanism that would help cover the difference between the two prices. And because local authorities do not respond, as required, our patients have some difficulties with getting the medicines free of charge. I hope that after the end of our broadcast, after the end of our conference, together with heads of the centers, we will have an additional discussion as to how we can have a positive impact on this situation. We should also keep in mind that the war is ongoing. It's a scary war. We have people from Kharkiv region. Kharkiv region is being shelled on a daily basis. We have people from Zaporizhia region here as well, and they are shelled every day as well. There are missile attacks, there are drones. We also have people from Donetsk region here. We were supposed to have a participant from Donetsk region. So taking into account the hostilities and the war, we all understand that even with a budget available per region, the majority of funds are allocated for the support of the survival of that region. We have many issues, we have many problems, we cannot deny that, but we are trying to solve them as soon as possible. Let me draw your attention to this slide. So this slide exemplifies the financial support that we have been receiving, and then I will tell you more about the number of people that we were able to help. With the support of different NGOs such as Orphan and Slovakia, CF Europe, and here on the screen, you can see that CF Europe donated 29,000 euros, and these funds were used to ensure humanitarian support to families who have either two children with cystic fibrosis and are staying in Ukraine, or there is a mother who is having a kid with cystic fibrosis and the father is in the army. So we were trying to provide targeted support to such families, and also we were trying to help families with many children because we realized that they potentially didn't have enough resources to raise their kids. So we also distributed food kits, hygienic kits. The hygienic kits included all the essentials. Uh, we also provided chargers so that a kid with cystic fibrosis could hide in the bomb shelter and continue inhale therapy.
I would also like to mention what was mentioned by Tatiana Mikhailova, the director of Orphan Sonetsi. They helped us buy the reagents for the reference center of molecular diagnostics in Kyiv. This is the center affiliated with the Ministry of Health, and in that center, the patients who haven't got the post-screening, who haven't passed the screening, and some adult patients that have some manifestations of the disease but don't have the confirmation of the genetic mutation. So we made an agreement with this center and we bought the reagents for 176,000 hryvnias for the whole of Ukraine. The patient doesn't have to pay anything. He just needs to send the documents, which is about 50 hryvnias in Ukraine. These are copies as compared to the overall amount. So people having a suspicion that they have CF or don't have the results of genetic examination can do this. It's very important for us because we need to know how many patients are subject to the Trikafta treatment because there are some categories of mutations that cannot undergo this type of therapy. Also, we should mention that we printed leaflets and flyers and we supported the families with food kits. We also had some communication, and today we're going to listen to the presentations of our colleagues with whom we communicated. These are the people who helped us bring in humanitarian aid from Poland. For example, Pavel, and thanks a lot for this opportunity provided to us. Sorry for this chaos we were creating for the sake of saving Ukrainians in your office, but we are so grateful to you for the assistance because that has provided our patients with an opportunity to get everything they need to survive. Otherwise, we wouldn't have this meeting today. were it not for your help. And we also bought vitamins. We communicated with the Polish organization. We found that it would be so difficult to do this. And even if we have money, we as the Ukrainian Association cannot buy vitamins in the EU member states because SWIFT payments are prohibited for the period of the military actions. So even if we do have the money in the accounts of the association, we can only direct this money to help people who are in need in humanitarian aid, people who will be in need of examination, and this examination can be held in Lviv. I will tell you about this later. So, as far as the first package of target therapy for children from Kherson is concerned, so I can tell you that we've got two severe patients in Kherson. They need to spend more than 24 hours on train, and we understand that those families will not be able to come to the center to be examined and then go back for 24 hours with this child in a severe condition. We need, as the association, to take care of provision of accommodation to those two families for about a month for them to be able to have all this examination, and only after that, if they won't, they can go back to Kherson region. I will also have a talk with the assistant from Zaporizhia region, and we will consider the situation in your region for those families who have patients in severe condition and who requires this support, because we understand that it's going to be very difficult for them to just come to Lviv on their own. So we will have a talk, and I hope that we will settle this issue. I would also like to say that a lot of humanitarian aid was provided by different organizations, and recently I've sent out DACA's vitamins that were procured by the Italian Association, and we also got, over the recent period of time, I mean, we got 100 Pariboy inhalers, and they were also sent to the patients that really were in need of them. I would also like to mention that over those 2 years, we have performed 23 transportations. This is Poland, Germany, and Austria. In most cases, maybe I don't remember something specifically, but while getting ready for the presentation, I was verifying all my data as to the number of transportations with humanitarian aid, and that's what I saw. This is the number of logistic operations and logistics functions that were performed. Then more than 5,000 parcels were sent within the period of 2 years throughout Ukraine. It should also be mentioned that 3 patients were examined for organoids in other countries. This was Belgium, the Netherlands, and Portugal. We needed to do this in order to understand whether any of the innovative methods fit well for those patients with very rare mutations but who are in need of urgent treatment. Also, I would like to mention that, well, you can see this actually in the slide. This is our Polish organization, actually Pavel's organization. There is also Olena Primak, who is staying in Poland. This was one of the first organizations that supported us. Also, Katarina Stepankova was among the first to support Ukraine. And today we will listen to Katarina's presentation. But continuing the cooperation with Ivano-Frankivsk Center, she was not afraid, together with her colleagues, of coming here. While Ukrainians were fleeing Ukraine, Katarina kept coming to Ukraine to do this project, to implement the project launched several years ago. I would also like to single out great support coming from Attenspende, the German charitable foundation headed by Christina and her team of people who employed in that foundation and who keep supporting Ukraine, gathering support for Ukraine. They are doing all they can, and thus they enable physicians to treat, and they give our patients the hope that they will get all the treatment that they need. I would also like to express my gratitude to the person who represents Upper Austria. This is Elizabeth. And on those days when we are having a meeting today and tomorrow, I think that we will also listen to Alexander Herbitsky's um, team. And he, together with his team, went to Austria several times to either collect some food kits or to pick up medicines or everything that that Upper Austria raised. So Elizabeth keeps working with us up till now. I cannot but mention the 24th of March, which was the crucial date for Ukraine, when, while communicating with the Vertex and CF Europe company, we heard the great news that really left me speechless for several minutes. I could not do anything but cry because we really covered a very long negotiations path for almost 3 years. For almost 3 years, we had been having correspondence, we had been having meetings in Zoom. Last year, we had an offline meeting in the Netherlands with the Vertex Directorate, and we communicated on further cooperation and working with Ukraine. And finally, on the 21st of March this year, we got the news that yes, the therapy will be available for Ukrainian patients, and it will be lifelong therapy for all those who to whom this therapy can be applied, starting with the age of 6. I would also like to mention that the very company, Vertex, has developed and voiced their criteria related to how they are going to cover Ukraine with this therapy. And we cannot violate those rules and regulations. We need to comply with them. We primarily need to do our best to embrace all patients with this therapy. And here are those three preconditions. The first condition is that Lviv region and all those who are registered in the Center of Cystic Fibrosis here, for physicians to be able to provide assistance in time in case of any possible violations or disorders or deteriorations in the health conditions. So this should be done in the region. The second criterion is, and by the way, we last week we had a Zoom meeting. Well, sorry for the quality, but you have the picture with 35 physicians from all the regions of Ukraine present at this Zoom meeting, and there we discussed how we could apply a strategic approach to our next step, which is that all those who are in Ukraine, who are under shelling and missile strikes, you know, we have learned to differentiate between drones and missiles and other flying objects, but we need to be respectful about all those patients, regardless of how we treat them in our personal life. We should be respectful for everyone who is in Ukraine. So the second stage is that really we are focusing on everyone who is in Ukraine, all patients. And starting with New Year, there will come the third stage, during which we will discuss and monitor the condition of patients who are willing to get back to Ukraine from abroad. So that is going to be the third step in providing for healthcare for CF patients. Let me show you the following. Suppose there are two components by which we generally understand what the total number of patients is. The first one is the need, the demand collected by the Ministry of Health from all regions. These are citizens of Ukraine, both children and adults, who have got the citizenship of Ukraine regardless of whether they are staying in Ukraine or whether they have left the territory. So as of the beginning of 2022, we used to have 998 patients. And as of the beginning of 2023, According to the applications made, we have got 1,009 patients. And also, it should be pointed out that in 2022, 36% left Ukraine. And if we take the year 2023, according to our data, 34% are abroad, which means that there are some families that are getting back. And we need to realize that there are also the children who are born, who are newborns. Just in brief, because I seem to be pressed for time, right? So, just a couple of words on what has already been mentioned by the previous reporters. Starting with 2022, we have got an opportunity to do screening for all newborns with the consent of their uh, parents who want to check whether the child has got any rare orphan diseases. So we are holding the screening for 21 nosologies, and there is the order of the Ministry of Health number 510, not because, well, Natalia Ostropolit from the ministry has already told about this order, about the network of reference centers. And now when we're talking about cystic fibrosis, we've got two reference centers, approved reference centers for CF. This is in Lviv and in Ivano-Frankivsk, the pediatric center and the pediatric hospital. Let's hope that there will be more to come. Here is the list, and I will not, of course, be reading it out, but just in brief, let me mention what it means. What is the reference center, and why is it important for the center to meet the criteria that have been approved by the ministry? So, the main components here are that the reference center should work towards improvement of the health condition of the patient. It should be able to control the condition of the patient. It should have an opportunity to communicate with foreign partners, foreign physicians and centers in order to exchange experience. And to conclude, let me mention that this year I got the award, the Laureate of Patient Advocacy 2023 from the European Association. You know, it was a very exciting event, but I'm more than sure that this is not my personal award. This is the award given to Ukraine as such. This is our common achievement. It wouldn't have happened without you. And the core strategic things I would outline that we need to work in the future are establishment of the network of reference centers, training of physicians in European centers, cooperation and experience exchange, connection of all the regions to the European CF registry, and the main thing we're going to work on is registration of innovative therapies in Ukraine, because it's really important to have not just humanitarian aid coming, because it has a tendency to finish, and we need to understand that it's exhaustive, and one day we will have to do our own planning and to really cope on our own. That's why registration of Vertex company products uh, need to be discussed already now. We need to talk about that, because in a year's time we will need some legal grounds to apply this innovative therapy. So that's all from me. Glory to Ukraine. Well, sorry for taking too much of your time. Actually, it was supposed to be the time of the other reporter, and now we will listen to the speech entitled "The Focus on Cystic Fibrosis: Ukrainians in Wartime" from the Vice President of the Association, Yulia Bobzo. So I'm happy to welcome all of you to this conference. I'm so sorry that I'm not with you physically, but I'm facing an exam in the nearest future, and I'm really sick, so I failed to come. But thanks to new technologies, so we have an opportunity to join at least online from any part of the country. So today's conference is dedicated to the European CF Awareness Day, and almost in all the European countries on those days we have a number of events like conferences dedicated to awareness of residents. And you know, it came as a pleasant surprise to me that in Germany, almost every second person knows what CF is. Almost one in four people knows someone who has cystic fibrosis, and that is also a tendency coming to Ukraine. We have an active Instagram, Facebook page with a lot of information enriching this awareness, and we have trailers, we have photos of our patients shared by patients. We have had online meetings with pediatricians, with gastroenterologists, with different physicians, so we don't have to stop on that, but it's pleasant to see that the word cystic fibrosis comes as no surprise, and at the same time as the collocation genetic disease comes as no surprise to our residents. I would like to kind of wrap it all up for what we had last year. Last year, in spite of highly tragic events in this country, that year was a remarkable year. And one of the greatest achievements that we got was victory for all our patients. So let me start sharing my screen, and you will understand what I'm talking about. I'm really happy that the slogan "To beat Trikafta in Ukraine" is no longer a slogan. It's our reality, and we've got almost 70 patients with cystic fibrosis in Ukraine who have started taking this modulator therapy, and almost 250 patients are waiting for the treatment to come at the beginning of next year. And all the other patients who aim to get back to Ukraine, and patients who are already about 6 years of age will also join in that process, which means that all the Ukrainian patients will be embraced with this therapy in case they are in need of that treatment. And I would express my gratitude to physicians from Lviv who have undertaken this huge responsibility. 4 doctors, 3 of them dealing with children, 1 of them working with adult patients. So they have taken on this responsibility, which is a really huge burden because it's a lot of work. They are doing this the screening for their patients in the centers for them to be treated with Trikafta. I'm bowing low to them. You know you're our gods. You are not just ordinary humans. Here is another critical event that was held. It seems to me that we still managed to find at least some program thanks to which our Marta Sheremet, our young doctor, a pediatrician, a child pulmonologist who works together with Ludmila Babar in the center, she has found an opportunity to join German doctors who work in Erzberg University Clinic in the CF center, servicing almost 160 patients with CF. Unfortunately, we failed to get into the program that presupposed 2 months of training or 3 months of training, but this was more coming like the experience exchange, taking the experience of German doctors. So for almost 2 weeks, she stayed in Germany, and I'm really grateful to the Gibberstein family for helping us to find the donors who made this possible and who accelerated this process. I'm really proud of the fact that in Ukraine we do have such experts who want to develop further on. They are interested in something, in the innovations, and they are allocating special time to their own personal development. And I'm really grateful to Ludmila Babar because when her hospital had about 10 patients a day, but at the same time, having all those blood tests, all those tests, she anyway let one of her specialists to go to this training. I'm really grateful to her, and I'm proud of the fact that really we have high quality experts. And you know, this family hosted her, showed her everything to her in the clinic, and she stayed with them 2 weeks. over that period of time, she became not just a colleague of them, but they actually treated her as their child in a way. They paid as much time as only possible to her, and I'm really grateful to them. I think that we have not to stop. We need to work on in that direction. And about a month and a half ago, me and Larissa hosted a meeting with the Austrian colleagues, and next year we will be looking for the programs that would enable our experts to at least go to on some short-term training courses because there they can enrich their knowledge. We didn't have any experience of working with in this clinic with such medicines. So this experience, this information is invaluable. So I'm very happy that we managed to at least launch this process. Then getting back to treatment and to the modulator therapy, I'd like to say that it's very good that we've got it now in Ukraine. Almost 70% that have got mutation number 5 of 8 will have their needs satisfied. But what should the other patients do? I've been getting a lot of messages from different people who keep asking what they should do, and they claim that okay, they will have access to therapy, we won't have, but please not to panic. Everyone will have everything required. This year we went to a conference in Vienna, and I really liked the speech by a Brompton doctor. It seems to me that this is the doctor biologist, the researcher. So he told a lot on how happy he is when the life of his patients taking Caprio becomes more full-fledged. But he also said one phrase: not a single researcher, not a single doctor can give up until all patients get dignified treatment. And the 10% of patients who are not covered by treatment so far just need to wait a little bit, because in the world we have a lot of new developments coming. Scientists are looking for additional medicines that would help us satisfy the needs of all patients, regardless of what mutation they have. Also, I would like to mention that Vertex has already had clinical examination of CAF trio, which is Trikafta, that we get for patients that don't have mutation number 508. These are soft mutations with preserved functions, normally of the fourth and fifth grade. So they had a research focusing on about 500 patients, and 18 mutations have already been selected for approval with the EMEA in order to get the license of CAF trio for patients with those mutations. Unfortunately, the results have not yet been published. We don't yet have the list with mutations, but I think that in the nearest future we will see them. So those rare mutations that are still there and that are still uncovered will finally also be covered with CAF trio, which is the genetic corrector. I would also like to tell you a couple of words about HIT-CF, which is a research project. It's like a unit of CF Europe. These are people dealing with collection of data about patients with ultra-rare mutations. Why are they doing this? They coordinate this data with patients, with their parents, and pass the data on to research laboratories and research centers, to some foundations that are dealing with research and invention of advanced treatment methods. I've already been publishing this brochure for several years, in an updated version, of course. So if you're interested, you can find this brochure on our Facebook page. Every year I have it updated. It seems to me that this year, either in June or in July, I actually did this. So what is HIT-CF Europe? This is a research project collecting the data. And, well, you can read this brochure because it tells you how the testing is performed and what intestinal organoids are. This is a topic we've been talking about for a long period of time. So let me tell it by my own example. My child has two rare mutations, but they're related to the first grade, which are severe mutations that, in fact, do not preserve the function of the lungs and the function of this gene, of this protein. It doesn't work that way. That's why we understood that all the medicines that we currently have, which are four, most probably will not be fit for this child. But I understand that he's a small child and he cannot be subject to any clinical tests, clinical trials. So finally, I learned that there is a research of intestinal organoids, and so we went to the Brussels. This was the beginning of 2019, if I'm not mistaken. We went to Belgium, to the Brussels, and we passed the organoid test through biopsy from the colon. You just take a part of mucous membrane, and this is a safe procedure. The child didn't even feel anything, and in laboratory conditions, these organoids are grown up till a certain size, and then there is a test of those organoids in laboratory conditions using different medicines. That is a great plus for the patient because the patient, in fact, is not involved in that process, but his cell is involved in that. Well, the cell has all the DNA copies, all the copies of gene mutations represented in that body. So, about a month later, after those tests, we got the result that no therapy would have a positive effect on the organism of my child, which was actually what I knew. So almost 4 years have elapsed, and about a month ago I got a letter saying that Kaftrio would not have positive response in her body. Just zero response. So we signed an agreement with that laboratory. We gave a consent for the organoids of my child to be passed on to other research centers that will be dealing with invention of new medicines that could probably work well for those mutations. And here at the bottom, well, you can find it on Facebook. There is a link to the website of this project, and there is the email. So in case you have any questions, you can ask. I know that we have another child, a boy in Ukraine who has also got such rare mutations. They also went to these clinics, also gave their organoids, and these organoids became the basis for testing. These are not yet medicines. These are just some structures, some substances that probably could work well for patients with such rare mutations. So these medicines are now tested in Europe in some research centers. I think that's a very good opportunity to help. People don't have to undergo clinical trials on their own, just their cells are engaged in that process. So if you need any further information, please feel free to contact me. Here is a link to the email where you can write it to me. And as far as the year 2024 is concerned, the process has been closed, but at the beginning of the next year, the new round of testing will start with the organoids of the people that have come for testing and that are preserved in that laboratory. Also, I've just translated this information from PCF Europe. They are devising new medicines, new producers are engaged in that process. These are mRNA therapy. It's like a cell bearing the right information that will get to the lungs of the patient and will try to remedy the broken gene and will make it work in the right way in the cell which is working in the wrong way. The disadvantage in this therapy is that there is a quick splitting inside the cell, so you will need to resume this therapy, but there is a research ongoing. We don't yet know how how many times it should be done, but probably 1 or 2 times a week, and this is going to be inhaled therapy, which will fit well for all the mutation in patients with all types of mutations. And as far as the price is concerned, the rumor has it that it's going to be much cheaper than what we currently have in the market. And here is the video. I don't know whether I should show this video. Probably I'll just give you the link to the website where you can read this information and watch this video. And here is another development, but the function is pretty much the same. This is the inhaled product that's going to be inhaled by the patient, but now the clinical trials are still in phase 1. You again can go to the link and have a look at it. There is a lot of information on for those who need it. It's very simple, and on the website you have got information about all the developments and the phases in which these developments currently are. For what mutations they will be valid, with mutation 5 of 8, without it, what should be the indicators for the pulmonary function. So everything that you want to find there can be found there. Well, a lot of developments are now being on the way, so if you're interested in that, you can address me and I will help you find it. I would also like to tell a couple of words about our activity. In the city where I now live, this is Yursburg, so in that city since February this year, it has become a twin city of Lviv. And a lot of events have been conducted by us. We have joined some other events together with the MRIA Association, which helps Ukraine, which is supporting Ukraine. So we raised money for food kits. In the winter time, we also raised the money for some food. We were just cooking borscht and varaniki in winter time, but we really raised a lot of money. It was about 7,000 euros, and for that money we actually bought, I'm going to show you what we bought. This is a resuscitation vehicle which went to the combat area in February this year. It is staying somewhere close to Zaporizhia now. And no matter in what events I'm involved, I always keep telling about Ukraine, about our community, about CF patients. And there have been a number of interviews taken from me. We like emigres, but not ordinary emigres. Ukrainians are no ordinary emigres. These are the people with self-identity, clear self-identity. And, I'm really happy that Ukrainians are respected as the nation. Ukrainians are respected as Europeans. And I would wish everyone not to give up, not to lose faith. Live in love, with love in your heart. And those who have joined the conference offline are lucky. So I wish you to have good luck here, to enjoy your communication with each other, hug each other, love each other, smile, cry for happiness, because, really, in our community, we have a lot of things we should be happy about now. And please enjoy this aromatic, beautiful city of Lviv. And I wish quick victory to all of us, to all Ukrainians. Thank you for attention. Have a nice day and stay safe.
Thank you very much, Yulia, for the video that you've sent. Thanks a lot for all of the work that you've done over the years. And we know that Naila was also supposed to be here, but she was unable to come because Naila lives in Germany, and this is the requirement of the country where they are staying. They cannot leave the territory of the EU for a long time. They can travel around the EU, but there are some limitations with regards to traveling outside of the EU. Thus, the ladies are joining us online. And we are ready to listen to Naila Brushko, the Vice President, who will present the topic of cooperation with European charitable foundations within the framework of supporting patients with cystic fibrosis. Good afternoon, dear friends. Welcome to our annual conference dedicated to cystic fibrosis awareness. We are having this conference despite the circumstances. I'm really happy that we are having this conference this year, just like we had it during the previous years when I was able to attend in person. I almost never missed a single conference. I was happy to have the opportunity to meet you, to exchange information and experience. And I hope that we will be able to resume this format in the future. And I'm really happy to see our European friends and colleagues amongst the speakers. They've been helping us since the beginning of the war. I'm expressing my gratitude to you for finding the time to come to Ukraine, to support us, to tell us about your activities, to share your experience, and also tell us how you see support to patients with cystic fibrosis in Ukraine. I'm grateful to each and all of you for finding the time, for leaving your families behind for the time of this conference, but this is an opportunity to relax, to meet new people, and I hope that this event will be really useful, full of positive emotions and impressions. My presentation today will be focused around the topic of our cooperation with charitable foundations in Germany. Why Germany? Because I'm currently staying in Germany and I have more opportunities to approach German charitable foundations, representatives of other countries who are present at our conference in person will be able to tell about their activities themselves. And I want to tell you about cooperation with European charitable foundations, and maybe with your support we will find a way to continue this cooperation. And war has introduced changes into the life of every Ukrainian, and we understand that without the support of charitable foundations, European charitable foundations, it would have been really difficult for us to survive. Many of such foundations were created a long time ago, and some of them were set up specifically to help Ukrainians who were affected by the war. And let me tell you, German charitable foundations responded to requests for help, and since many of them don't have big budgets, they help with items that are less pricey. And the first foundation is Atem Spender Foundation. It's indeed a foundation that was able to do a lot of great things. They were among the first to respond to our request for help. So Adam Spender was buying oxygenators. They helped with antibiotics, both in pills and those that are administered intravenously. And a great support was provided by them in transportation of the humanitarian aid collected from other partners in Europe. These are CF Europe, Ridakas Vitamins, and the German Cystic Fibrosis Association. As we can see on the next slide, Atem Spender, together with partners, helped Ukraine for a sum of over 500,000 euros, and 50% of that money was spent on transportation, while the other 50% was spent on purchasing medicines. Transportation of humanitarian aid to Ukraine is an issue that is worth noting. It takes a lot of time. You need to prepare documents. You need to cross the border. It takes a lot of effort, and many foundations right at this stage refuse further cooperation because it's too difficult to deliver humanitarian aid to Ukraine. The next slide, please. It's also important to note that some staff members of Atom Spende Foundation got together with their friends, colleagues, and other like-minded people to organize medical evacuation of oxygen-dependent patients to European countries. So they involved aviation, ambulances, support of doctors, so that a patient from a Ukrainian hospital could be transported to a European hospital. We had a clear chain designed involving Ukrainian charitable foundations, and we are really appreciative of the support, and we really want to say thank you for the support of Ukrainian patients, and we are really grateful for your effort aimed at saving the lives of our patients. Next slide, please. The other organization that eagerly helped Ukrainian patients is a charitable foundation, Kolos. I can tell you a lot about this charitable foundation because I know everything about their activities because I'm on the board of this charitable foundation. The foundation was created at the beginning of war by Ukrainians who were staying in Germany for some time, and they got together. At first, they collected food, clothes, and other items which they sent to Ukraine, and then they started helping Ukrainians who arrived in Germany as refugees. And then these Ukrainians joined the organization, and together they started collecting more humanitarian aid to be sent to Ukraine. The humanitarian aid included generators, functional beds for hospitals, wheelchairs, food items, water cleaning stations, Christmas gifts for children, support for the servicemen, support to hospitals. So our cooperation with this charitable foundation started in the following way. When I first discovered this foundation, I approached the management and told them about our needs. But according to the charter of this charitable foundation, they cannot procure medicines. So we started looking for ways to help Ukrainian patients, uh, to help with something other than medicines. So we decided to help with food kits to increase calorific intake, and we wrote an article to a newspaper explaining our demand, and very quickly we were able to collect the food, and we first had 100 food packages and then another 50. Another important aspect was buying replaceable cups for inhalers, something that is really necessary for the support. And there are some discounts at the moment for Christmas season for the elderly people and for the children, and charitable foundations are eager to cooperate with us and to cooperate with our association. They are trying to look for ways to help us, but we need to formulate our demand in a really specific way. We have to be really precise. So should you have any ideas as to what could be useful for patients with cystic fibrosis, please approach me. Something other than medicine. So we will try and find ways to implement such a project. It's just a project that is being developed. So we are trying to help a cave hospital with nanodoc apparatus, and it's not that easy to buy it in Europe. There are some aspects connected to buying such things in Europe, but hopefully we will be able to solve this issue because the foundation wants to help. They have the funds required for that, and we only need to find a way to help. Maybe together with Ukrainian doctors, this issue can be solved. So I will be approaching Larissa. Maybe together we will work something out. On the next slide, I would briefly like to tell you that we are representing Ukraine in Germany during different events. We are organizing meetings, rallies in support of Ukraine. They are held at the central squares of cities. We are telling people about the needs of Ukrainians, about how Ukrainians are living. This is something that has to be reiterated because as soon as you become quieter, people start forgetting about you, and you constantly need to remind people that Ukraine still exists, that people in Ukraine need help. And we are organizing gratitude events, and we invite German people to such meetings so that they can learn more about Ukraine. During such events, they can taste delicious Ukrainian foods, and during such events, we organize fundraisers to collect money for the armed forces of Ukraine and for the citizens of Ukraine. So if you have any ideas, feel free to approach me. Let's work together for the association so that we can help people who are staying in Ukraine. We can deliver humanitarian aid to the border. Then there is charitable organizations, Здійснити мрію, which then transports the humanitarian aid across the territory of Ukraine. So I'm urging you to cooperate with us because together we can do even more to help patients with cystic fibrosis. And at the very end, let me depart a little bit from the topic of my speech, and I want to tell you about something that is really important for all Ukrainians. Sometimes it seems that everybody who stayed in Ukraine are reproaching those who decided to leave. People are criticizing us for the very fact of crossing the border. And this is just the strategy of Russians to have two camps of Ukrainians who will be fighting. And we need to be together. We need to be united because that's a requirement for our survival. We need to do as much as possible for people to want to come back to Ukraine so that they can live in their own country and pay taxes in their own country. I know of several cases when unfortunately people and children are degraded by classmates when they come back to Ukraine. It's all really emotional and unfortunate that such cases happen. And I hope that in our community, everybody is able to use their critical thinking without separating people into patriots or non-patriots. It's a very negative feeling when you are feeling like an alien in your own country, and sometimes people criticize you for not loving Ukraine enough, for not donating enough for the armed forces. Not enough, not enough. And I really hope that we won't have cases like that in our community, and when people return to Ukraine, they will feel needed. They will feel that somebody is waiting for them back home. Thank you for your attention, and I'm waiting for your suggestions and proposals for cooperation. Thank you. Thank you very much, Naila. It was a really interesting speech. Thank you for all the work that you are doing abroad. I spoke with you and Yulia before the conference, and I know that in your thoughts you are together with us. I also know that you want to come back home to a peaceful country where neither one of you will feel afraid, where you will not be asking questions, am I going to wake up the next morning? We know that the circumstances have divided people, and even the slides that I was showing, I can tell you that almost 50% of our patients are people who left Ukraine and are staying in countries abroad. So let me tell you, the longer we have this bloody war, the less patients will be back home. But we want to do everything possible so that you, Yulia, and all the other people who are currently staying outside of Ukraine, you've been there for almost 2 years, but we want for you to come back home and together with the girls, if our videographer could just show our hall, just show the audience to the ladies. We want to express our gratitude to you both. We are passing warm regards from all Ukrainians. Later on, we'll take a family picture where many of us are wearing embroidered shirts. So thank you to those participants who have supported this idea of us, and thank you, girls. I hope that we will be able to see each other in the near future. You will be able to come back home. Thank you. There are no questions in the chat for the time being. So please, Naila, you can watch our broadcast online if you want, and then we can have a discussion in the evening. I'll call you. And now I want to introduce project coordinator and member of the association, Yulia Tkachenko. I've already mentioned Yulia in the first half of today's conference. When the war broke out, I left Kyiv on the fourth day because a helicopter was shot down. A helicopter with Russians was shot down not far from my home. I heard loud explosions because in the district where I'm living, there's a military unit stationed, and we had to hide in basements. It was really difficult. It was unbearable. We didn't sleep for 3 days in a row. We couldn't afford to sleep, so a decision was made for us to travel to the center of Ukraine and stay there. So we were just making the disguise nets, and we are joining many of the initiatives in support of the armed forces of Ukraine. And Yulia is a person who stayed underground, who slept underground, and her daughter Nastya is here today. And in the underground, Nastya found a friend, and she was telling Yulia that they needed to go back to the underground because she wanted to talk to her friend. So the children were staying at the underground stations. They were making friends. They were learning there. So we want to thank CF Europe, Hilda, Lydia, and Jacqueline for joining our Zoom conference on the 28th of February, and together with Yulia, Yuri, and others, we were able to have a conference. It was not a conference, it was a meeting during which we were pleading for help, for shelter for our patients. Yulia, the floor is yours. Good afternoon, everyone. Let me introduce myself. I'm Yulia Tkachenko, and for 8 years I've been a member of the association since 2021. If I'm not mistaken, I've been a project coordinator for the association. I also have a daughter who has cystic fibrosis. She's 11 years old. Her name is Nastya, and I want to tell you a little bit about the activities of our organization. The topic of my presentation is implementation of projects grants in wartime Ukraine, but I will tell you about some initiatives from before the war period. So I will tell you about my very first project. It was my learning experience. Larissa just became the president. And it was a project titled Training on Advocacy and Expert Support of Advocacy, with the support of Yednanya organization. So we were just all learning during that stage, and our friends helped us with that project. Friends who were teaching us for a long time, 100% of life from Rivne. The sum of the first grant was 49,800 hryvnias. We submitted project proposal in 2016 and the project was implemented between October 2016 and March of 2017. The project was aimed solely at organizational development. The participants of the project were active members of the association, heads of regional departments, and these people received training during 6 months. They received training from qualified experts and professionals. They were all from 100% Życia Rivne organization, namely Yuri Nazarevich. We had 3 groups consisting of a charitable foundation Happy Child, charitable foundation Open Palms, and All-Ukrainian Association of Care of Patients with Cystic Fibrosis. So is the clicker working? So you can see Yuri Lazarevich in the pictures. He's delivering a training for us. It was the second training of the type in which we participated because the first training in which the association was a member, it seems to me it was Nastya Tkachuk who was involved in the design of that project. So this is when I met all of you.
But here I'm talking about the specific messages and programs that we wrote together with Larissa. The next one, well, there was a rather long break between those two projects, and back then we were actively advocating the rights of patients with cystic fibrosis in Ukraine. We had a number of campaigns, rallies, meetings. We were working with the Verkhovna Rada, with the Ministry of Health, that was very active and luckily with good results. So the next project was already in the year 2020. It was about provision of access to patients with cystic fibrosis with the support of the International Renaissance Foundation. The amount of the grant was 150,000 hryvnias. It was written and submitted in 2022, and the project was to complete in July 2021. So it was aimed at the approval of the methodologies of regional programs for supporting patients with cystic fibrosis. So this was all done for the regions which didn't have any regional programs. We wanted to create and to implement those programs, to budget them from the local budget, and special attention was paid to Vinnytsia, Zhytomyr, and Mykolaiv regions. In the course of the implementation, we changed the Zhytomyr region for Khmelnytsky region because it appeared that the performance rate was better there. So the achievements, the funding was increased for the current target program for CF patients in Mykolaiv region by 2 times. So it was doubled. Then amendments were made in the current urban program, and there was a special item in this program for special medical nutrition for CF patients, and the head of the center was engaged in the task force of the region dealing with writing of terms of reference. That all happened in Khmelnytsky region thanks to our project and, of course, to the head of the unit, Margaret. I wonder if she's here. She is here. So that was quite illustrative for us. She really is a very calm but a very persistent person, as you have come to realize probably. So thanks to the project implementation, the heads of all the other units of the organization got information and legal knowledge related to the implementation of the city and regional programs. In the picture, you can see a field trip to Mykolaiv region. Within that project, that is the Department of Health. That is the doctor whom we approached, and this is the vice president. She used to be the head of the unit back then, no? No. So that was the meeting with the vice president of in Mykolaiv region, Yulia Babza, who lives in Mykolaiv, and she helped us. And now let me talk about the project activity during the war. So the outbreak of the war came as an unexpected thing for everyone. I mean, our perception of it. Um, we were supposed to have the conference on the 24th and 23rd of February, so we had one over the conference, and then it all came. Of course, it was fear, despair, uncertainty, subway as a shelter, cold in the first days, in the first week. But then we came to realize that we cannot just be sitting and idling. So we came to realize that we need to do something about it. Otherwise, we will have no medicines. There will be lack of a lot of other things for our patients. And we came to realize it on the third day. So, of course, our European friends came to react very quickly and started supporting us. And in this picture, you can see our Zoom conference. Larissa mentioned that was the first Zoom meeting. And our partners from the European member states started responding very quickly. As far as I remember, 2 or 3 weeks later, the first humanitarian aid packages were supplied to Lviv. And here is my daughter and my dog. She's very happy here, as you can see. The first project was written by CF Europe, right? It aims to provide comprehensive support to CF patients in Ukraine and not only, including humanitarian, transportation, organizational costs. Larissa was in charge of that project, and she has actually shown this project to you. I was involved in that project as a coordinator in case Larissa asked me to do something, or I could do the packing, I could collect the information, or everything that was necessary. Let me add a couple of words. Just wait a bit. I just needed to tell this that we have this project, and Larissa has actually covered it to the full. I just wanted to add that when war broke out, the first aid and well, probably there are no people who didn't get any financial assistance. So this was primarily financial assistance, and we primarily covered all the patients who were leaving Luhansk and Donetsk and Kharkiv regions, also Mykolaiv region. And I asked the heads of our centers to give the contacts, the people to whom we should provide financial assistance, and this assistance was provided. It was doubled for several families because in some families, unfortunately, we have such families where we have two children with cystic fibrosis. We also have a family from Dnipro where two children have cystic fibrosis and the husband is a serviceman. He's staying in the front line. So we realized that we should be providing financial assistance to such families in critical conditions. We should protect them. We should support them to the best extent possible. So probably you saw it on my slide that from the beginning of the war and up till now, we have provided financial assistance to more than 400 families. And there are some families that have got financial assistance several times. And I'm explaining why. We need to tell about this. So we need to explain that we do have families where the eldest son is at the front line. And here we have the head of Ivano-Frankivsk region center. So there is a family there where the eldest son is at war. My daughter, my elder daughter, went as a volunteer to their army. She's also at the front line, and we have some parents where the fathers are at the front line. We are all concerned, and we should be providing support to such families primarily because they are financially unstable, they are living in hard conditions, hardly making their ends meet. Thank you. That's exactly the assistance that we provided within this project on the first days of the war. Here you can see the activity within this project dealing with transfer, packaging. You can see our Olena in Poland packing humanitarian aid. This is what we sent to Mykolaiv when it was almost impossible to deliver goods anywhere. We also sent it to Kherson, but I haven't found the picture. We managed to do it twice for Kherson region, and that's it. After that, there were no longer any opportunities because, unfortunately, Russian troops, well, I cannot find the proper name for them, so they started taking away everything from our humanitarian aid. They didn't care that it was designed for sick children. But we managed to do it at least twice, and that came as a timely assistance. Here is the packaging process, foodstuffs. The head of the regional center here, this was brought from Austria. So this is all our activity. This is our large bus, and a good man from Britain who just found us. I don't know how he found us, but he wrote that he wanted to help us, and he brought such two large buses. That was hygiene kits, there were some sweets, so he was just collecting the basic things for this bus. And here are two guys who helped us from 100% Life Rivne. We are grateful to them because we came there and they just provided us with everything: the premises, the boys, the buses, the transportation devices. So just take it and use it. So these guys went twice to the border. They picked the aid from their bus to their bus. And one day they had an accident in Lviv. They didn't reach Rivne because there was there was flat. They got flat tire because the freight was too heavy. And here is another large-scale project. Someone from the European friends told us that we should write an application within that project. And Larissa gave me a call, said that there has come a recommendation to do this, so we tried. We looked through the information and we tried to write the application with no official data. We just wrote who we are and that we need assistance. And they said yes. So that was implementation of the program of supporting patients with CF and their families who've been affected by the crisis in Ukraine. The American Foundation Global Genes, their profile is orphan diseases. They mostly deal with research, and Orfani Synicy have already provided some information. The grant amounted to $20,000. The submission came in April 2022, and the implementation of the project was supposed to take place within December 2022. It was for financial support of patients, software, procurement of drugs and medical goods and medical equipment, as well as transfer costs and food packages. So that was what our coordination logistics center was doing back then. Everything I have enumerated was done with the money of our donors, so we are really grateful to them for that. And the result is that we have bought and handed over 200 hygiene kits. We have also covered the transportation costs from Poland, Great Britain to Lviv, and I remember that it was once or twice that we also sent it from Lviv. Then the mail costs, so like Nova Poshta, also sending humanitarian aid to hospitals throughout Ukraine, and we procured medicines on individual requests of clients. We also bought some consumables for hospitals. It seems to me that we embraced 50 patients within this project. These were patients who were heavily affected by the war in Ukraine. So that's what Larissa has been talking about. There are some families that have got financial aid several times because we understand that they need it badly. They need food, they need money. And here are the pictures. Well, this is all our work, some food, but I was happy that we managed to do this. We were so happy that we generally managed to do this, that we had our application approved. It was a very emotional stage in our life. Here is Larissa with a lot of parcels, packages. Our girls from Dnipro with the food kit. So these are packages, buses. Again, the next and probably the last project so far is humanitarian aid for CF patients in wartime. The network 100% Life Rivne supported with the European Union, so they had a tender and we made an application. The amount of grant was 374,900 hryvnias. The application process took place in December 2022, and the project was to be implemented within January-March 2023. So we just wrote an application. We told what we needed. These were food and hygiene kits and chargers for accumulators and accumulations themselves. That was when the blackout started. The goal was to provide CF patients with access to uninterrupted treatment in wartime, humanitarian aid in the form of food kits for such patients or their families. Also to provide humanitarian aid, well, that's what I've actually mentioned, hygiene kits, and to provide the 50 most severe patients with chargers or power banks. We decided that these would be not power banks, but chargers with accumulators. And the results were as follows. We helped quite a number of CF patients who were staying in Ukraine, and that was the project particularly for those who are staying in Ukraine. So patients and their families, in particular severe patients, managed to get food and hygiene kits, chargers for accumulators and for portable inhalers, and the very accumulators themselves. We also provided CF patients with access to uninterrupted treatment and maintenance of their therapeutic conditions in wartime. 200 patients got food, hygiene kits, and chargers. Then Larissa also bought it within the European project, but you need to understand that these were two different projects. At first, this one came, and then we saw that there is a demand for the same. So we actually funded the same within the framework of the European project, EU project. The same was food and chargers and hygiene kits. How is it all happening? It's not just we take 200 patients, we give something to them, and that's it. We see that there is always a need for food. So whenever we are asking something, we try to include food on that list of our demand. So if we cover 200 patients, we try to cover more. If there is an opportunity, we still cover some other patients from other projects. And it seems to me that we have helped really a lot of people as far as food is concerned. But I think that the problem will remain. We will still need food, and that's what we will keep doing. Also, I would like to mention that this project that we won from 100% Life Rivne, the main donor there was the European Union. So, there were about 160, if I'm not mistaken, organizations submitting their applications. And out of the winners, out of the 60 organizations, it was our organization that was selected for the field trip, for monitoring, to check how it was all performed. There was an audit coming, and then they invited us for an interview. On communicating with our team, they were pleased to see that we were so successful in the implementation of the project and reporting. They were really pleased to see that there are people like this who are just parents, but they are doing so much. And then they invited us for an interview, which is going to be published soon. So I think that on our Facebook page, we will place this video. We are proud of this because it all shows that we are capable of doing a lot of things and we are trusted. We have had no negative feedback concerning the implementation of the project or reporting from our donors. And, well, you can see I was pregnant at that time. I was packing things. These are chargers, batteries, food, hygiene kits, and here are our happy patients. So that is all for me, and I would just quickly cover the plans for the future. As I've mentioned, we have had no negative feedback as yet, and we are trying to look for some productive and useful ideas and opportunities for our patients. It's not that easy to find such tenders, to find such grants, but that's what we are doing. And we would like in the nearest future to shift the focus towards the organizational development, because we can see that the heads of our units have changed, and during the war we need to respond in a different way to all the needs. This ability to quickly respond and to readjust activity in wartime, well, these are important things.
That's what we want to do for our organization, and also we need to keep providing humanitarian aid in wartime to children, adults, all those who are in need via writing applications. So please join us in this process because it's not that easy to do this. Thank you for attention and have a nice day. I just wanted to express my gratitude to Yulia because really a lot of work has been done. And it seems to me that sometimes the impression is that this is so easy, but it's not. We are very open to all those who are willing to join us in the process of implementation of any projects. Please feel free to contact us. We will be happy because that is really a lot of work. And for every donation coming from the donors who are providing grant opportunities for every item, you need to do the reporting. And as Yulia has mentioned, we have got no negative feedback or comment coming from the donors. So please, we would like to see you among us in our team that will help us implement further projects to cover the needs of all our patients. I was looking at the chat while you were having your speech. There are no questions, so I would probably ask Katarina and Pavel to take your seats on the stage. Please stay closer to us. And just in brief, let me introduce Katarina. You know, I would like to say thank you, Katarina, just as a woman, as a mother, as the head of the association, as an active member of the European Association. Thanks a lot for the work you are doing, and thanks a lot for what you have done in order to study the situation with cystic fibrosis, not just in your country. You've been helping all of us on a very sincere basis as the real friend of Ukraine, so thanks a lot for that. So let me give the floor to you for your presentation on the activity of the Slovak Cystic Fibrosis Association in Ukraine. Katarina, the floor is yours.
Английский можно там. Môžem tak? Tak, pekný deň. A ja budu hovoriť anglicky.
Я буду говорити англійською мовою.
It's for me always very difficult to speak. I feel a lot of emotions, so I try to be more focused on my presentation. I would like to talk you a few words about Slovak CF Association and maybe about situation in cystic fibrosis in Slovakia. We are a very small country in the middle of Europe, but we have a short border with Ukraine, and I live in, I live in Košice, and Košice is the city 100 kilometers from Ukrainian border, so somehow I felt that for me it's very easy to travel to Ukraine. What was easy, it was not easy, never very easy because of crazy border, but it was more difficult and more crazy during COVID and then during the war. But I am here. So this is situation in Slovakia about cystic fibrosis. Our population is around 5 million inhabitants. We have around 320 CF patients in the country, 160, so it's half-half adult and children. And we have 6 CF centers, 3 for children, 3 for adults, and they are in different parts of Slovakia. We are a small country, but we have 3 CF organizations. The Slovak CF Association is the organization founded as last one in 2006, and I am the president of this organization. And in 2018, we created common platform of our organizations because of fight for Kaftrio and for modulators. So this new treatment really took together all families, everybody, what happened also in Ukraine and I think in every country. So this is our mission. We are very small non-profit, non-governmental organization with 1 employee. When we implemented project, we have 3 employees, and we had few volunteers. We do annual reports, and we are financed from membership fees, from assignations, donations, sponsorship, some public collections, benefit events, and from some grants. Main activities of CF Association is advocacy and lobby. First, most important advocacy was really for modulators. You can see now we have, it's from July 20, oh sorry, we started Kaftrio in Slovakia in July 2021, and until today we have more than 100 CF patients on Kaftrio and 42 on Orkambi. Then we advocated also for many years for standard therapy, so to really having reimbursed enzymes, antibiotics, physiotherapy, nutrition supplements. Very important part of advocacy were standards of care and creation of CF centers in Slovakia. We still not have CF centers according European standards, but we have centralized the care in some doctors. We have quite good physiotherapy, but we still miss a lot of services for CF patients. But we have neonatal screening, we have all centers, so all CF patients from Slovakia are involved in European Patients Registry, what is very important for everybody. And we have last standards of care we have adopted in 2021. Then we do a lot of educational activities. We organize CF conferences, not only in Slovakia, as you see, but also together with Pavel in Krakow and in Ukraine. Here are some photos. Oh. Then we also organize courses of chest physiotherapy in Slovakia, but also many of courses we organize also in Ukraine. So here are some photos from courses. Then we do a lot of material support for CF centers and for CF patients in Slovakia, and edit publications and educational materials. And here I have a few words about my CF Association activities on Ukraine. First time I came to Ukraine in 2008 to Uzhhorod. I was very much invited by Professor Horlenko from University in Uzhhorod. I came here with Igor Gauchet, physiotherapist from France, for 2 days visit. And since the day, we tried to find some money or some sources how to do some activities on Ukraine. And since this year, I started to travel to Ukraine. Here are some more important activities which I attended alone or with some other people. But most important activities we done on Ukraine, me and my organization, were 3 projects which were founded from European funds from the program of cross-border cooperation with Ukraine. The specific of this program is that it could be implemented only in cross-border regions, so in Zakarpatska Oblast and Ivano-Frankivsk. But we always try to manage this project that the activities, especially educational activities, were open for the people from all Ukraine. So first project we implemented since 2012 and 2014. There is the name of the, or title of the project, and it was realized in Uzhhorod in cooperation with Uzhhorod Children's Hospital. And then we, in 2017, we started to prepare a second project, which we started to implement in 2019. And it was this, we had to extend this project, and the end was in 2023, now in August. And this project was realized in Ivano-Frankivsk region. Also, the third project was also realized in Ivano-Frankivsk region, and it was since 2021 to 2023. Main activities of all three projects were education, so we organize a few workshops, conferences, trainings, so really many very useful educational activities. Then we, big part of the project was material support, so we were able to purchase a lot of equipment for Ivano-Frankivsk Hospital. This cooperation was with Regional Children's Hospital. It was really very good cooperation, and I have to say big thank to all people who cooperate on this project. Here is Maria Cook from the team, so she can say you more about the cooperation and how it was, how it really moved the situation of CF patients in this hospital and in this region. Then lobby activities, some publications. Here are some photos. As you saw, this third project was about creating the CF center, and because COVID came, war came, it was very, very difficult to complete the projects, the both projects, but in some moment I decided that I want to complete the project, and if I want to complete the project, we have to travel to Ivano-Frankivsk during the war and to really realize our planned activities. And we were really successful because you can see on the first picture there is the official opening of CF Center, and we were successful, and we were able to really realize our planned activities and open this maybe small, but I think it's I think it could be good example how you can change the situation in every existing CF center or place where CF patients are treated on Ukraine, that few people can change the situation. And I am really happy that we were successful. Here is our team. And we also, the part of the project I forgot is the CF Hero application, which was translated to Ukrainian language. And because of work, we had good help from Valentina. She came to Košice, and she helped us to complete this application. And then big part of our activities was also help for Ukrainian CF community during the war, and it was a lot to talk about this activity, not only from Slovak part. Here are a few pictures. We also were part of this humanitarian help, do collections and a lot of help. We cooperated with Czech Republic and Czech organization, and also with French organization who transported their help through Slovakia. And for us, the big help was Rotary Club, who was able to transport our help to Ukraine. At this moment, I stop my presentation, and from the projects, we made a small video about the project, and I would like to show you this video on this conference, on this meeting, and you can see what everything was done during the projects. So. It's Slovak-Ukrainian. Projekt dvojročný a bol pripravený v spolupráci našej asociácie a regionálnej klinickej nemocnice v Ivano-Frankivsku. Tu je projektový tím, ja, moje kolegyne Tania Fejtová, Renata Kovačová. Slovenská asociácia cystickej fibrózy je veľmi malá organizácia a zase vďaka mojim priateľom mnohým sa podarilo vytvoriť tento projektový tím, ktorý naozaj dokázal robiť obrovské veci pre túto komunitu ľudí.
І тоді, коли нам пощастило, і ми взагалі до отримання проекту, ми вже хотіли створити центр мукоисцидозу, щоб навчатися, як вести цих дітей. І тоді, коли Боженько побачив, що ми рухаємося в тому напрямку, ми хочемо, нам пощастило, і дійсно наша Надія Миколаївна зустріла Катерину.
Я хочу повернутися в далекий 2014 рік, коли на одній з конференцій з мукоисцидозу, до речі, яка теж проводилася в межах транскордонної співпраці, це було в Ужгороді, шановна Катерина Степанкова, шановна Галина Махов, підійшли і ми почали розмову, чи не могла би Івано-Франківщина, як прикордонна область, бути в програмі, тому що, в принципі, проблема мукоисцидозу для нас дуже є актуальною, наша прикарпатська популяція особлива. У 2017 році словацькі колеги до нас приїхали, ми ще раз зустрілися, і Дерев'яні було у нас центром мукоисцидозу, і Махов, і Бобер, і адміністрація лікарні, і генетики, і пульмонологи, і ми все ж таки вирішили спільно почати цю програму. Готувалися довго до нього, до того проєкту, але в 2019 році грант ми отримали завдяки, напевно, командній такій роботі. І з цього року у нас, Богу дякую, проєкт іде, і навіть більше того, іде до логічного завершення.
Spolu sme sa snažili zlepšiť, upraviť veľmi všetko možné preto, aby sa deti s cystickou fibrozou mali lepšie. Počas hospitalizácie, aj na ambulancii a minimálne, aby to vyhovalo štandardom, ktoré sú pre toto ochorenia dané a ktoré sú potrebné. Prvý spirometer, to je vôbec nový, bol spirometer, ktorý nám darovala Slovenská asociácia cystickej fibrózy. A tento spirometer máme dodnes a fungoval 20 rokov. Aj z toho prvého projektu už bolo citeľné, že je veľa vecí, čo sa dá urobiť v spolupráci s touto asociáciou. A tento posledný projekt, tieto posledné veci, ktoré sa nám podarilo urobiť, to už posunulo tú našu starostlivosť na vyššiu úroveň.
V roku 2019 sa nám podarilo zrekonštruovať a vytvoriť nové ambulantné priestory pre pacientov s cystickou fibrózou. Máme možnosť okrem prístroja na pilokardinovú ionoforezu využívať aj nový moderný prístroj ako Makrodu, ktorý sme získali s pomocou asociácie cystickej fibrózy.
Makrodot praxi je vlastne určený na stimuláciu proteína na porodovúče pacienta a následný odber vzorku priamo do mikrokapilárov systému kapilárov. A testovaný postup pozostáva z troch samostatných postupov, je to stimulácia, diagnózia, analýza.
Môžeme využívať nový ambulantný spirometer na stanovanie plúcnych funkcií u našich pacientov s cystickou fibrózou, ktorý takisto máme vďaka asociácii cystickej fibrózy. Ďalším prínosom pre našich pacientov je body analyzátor, ktorý nám umožní sledovať stav výživy pacientov s cystickou fibrózou a lepšie regulovať ich zdravotný stav. A myslím si, že obrovským prínosom je prístroj Simox, ktorý sme takisto vďaka asociácii cystickej fibrózy dostali a môžeme ho využívať hlavne u pacientov hospitalizovaných na našom oddelení a zároveň týchto pacientov edukovať tak, aby mohli tento prístroj kvalitne využívať v domácom prostredí.
Tohle je vlastně taková směsice 3 léků určujících na různých místech a jaký je teda výsledek toho působení, no, prostě úžasný. Stačily 4 týdny klinické studie, byla velmi krátká, během těch 4 týdnů bylo vidět, že se jim plicní funkce zvedá o 10%.
Klinický stav týchto pacientov sa výrazne zlepšil a cesta ako k tejto liečbe bola pomerne dlhá a náročná a vďaka intenzívnej spolupráci a podpory pacientov, rodičov, pacientských organizácií sa podarilo nakoniec túto liečbu pre pacientov s cystickou fibrózou vybojovať.
Я думаю, що однозначно проєкт дуже багато нам вже зробив, просто надзвичайно багато. І ми кажемо, навіть не очікували, що в нас це вийде. Саме головне, і мета його була створення того центру муковісцидозу, ми його створили. Були різні складності, і фінансові, і комерційні, і епідемія ковіда, і війна в нас в Україні, всі знаємо. Це досить складно було все фінансово забезпечити, і ту всю логістику, і так далі, але все ж таки нам вдалося відремонтувати приміщення, максимально його підготувати відповідно до стандартів для даної, так сказати, для даного закладу, в складі пульмонологічного відділення. Значить, тут створено декілька палат, значить, палата для проведення реабілітації, значить, лікарська палата для амбулаторного прийому.
My sa mali mať ten deň práve meeting online, keď začala vojna, čiže sme hneď vlastne riešili celú situáciu a ja od prvého momentu vlastne som neustále bola v kontakte jak s ľuďmi na Ukrajine, tak v rámci európskej komunity, ktorá sa naozaj tak zomkla vlastne počas tohto obdobia a všetci spolupracovali a všetci ponúkali pomoc a vlastne išlo to strašne jednoducho a tak skoro bez slov, každý vedel, čo má robiť a čo potrebuje. My sa dohodli, že skúsime, že dáme do toho projektu aj českú aplikáciu Hero, ktorú tu všetci poznajú. Podarilo sa to, tiež to vojna troška zasekala nám a troška sme museli zredukovať svoje plány, ale preklad sa podarilo dokončiť, aplikácia sa spustila, ukrajinskí pacienti to používajú.
До цього проєкту практично умов для лікування дітей з муковісцидозом ми не мали. Наші діти лікувалися поза кордоном або по клініках Львова, Києва. Це були досить дороговартісні. Завдяки цьому проєкту ми змогли забезпечити завдяки вашій допомозі, завдяки активній допомозі наших лікарів, ми змогли забезпечити всі умови для лікування тих дітей у нас в Івано-Франківську. Так що проєкт дав дуже багато. У нас цього року всі діти вже отримали лікування, хто потребував. Повністю діти забезпечені медикаментами, новітньою апаратурою. Зараз навчаються наші фізіотерапевти, реабілітологи, щоб повний об'єм допомоги діти отримали на našej bázi.
Robili sme vlastne mnoho veľmi závažných rozhodnutí, ktoré neboli vôbec jednoduché, ale my sme sa napriek všetkému rozhodli, že tieto projekty odimplementujeme, že zrealizujeme všetky aktivity najlepšie, ako sa v týchto vlastne zložitých podmienkach bude dať. Ale pravda je, že choroba si nevyberá ani dobu, ani podmienky a obzvlášť vlastne cystická fibróza. A vlastne tieto deti, tieto rodiny potrebujú liečbu a potrebujú pomoc a potrebujú
že mamičkou 20-ročnej dcerky, ktorá bola diagnostikovaná už v roku 2002 na cystickú fibrózu. Zo začiatku, vlastne, keď Maruška bola malá, neboli dostupné informácie. Práve preto vlastne sa začali robiť tie konferencie, stretnutia sa s tými rodičmi a vzhľadom k tomu sme sa stretávali viac s odbornou verejnosťou. Nie je každý rodič lekár, hej? Takže je to na tej konferencii podané tak zmysluplne a hlavne tí rodičia sa vedia stretnúť, tak ako naše deti sa nemôžu stretávať, tak aspoň si tí rodičia vymenia tie svoje poznatky, skúsenosti a hlavne máme tých hlavných odborníkov po ruke, môžeme sa s nimi stretnúť, môžeme sa s nimi porozprávať a oni sú veľmi ochotní na tých konferenciách, nakoľko majú ten priestor на то відградяний, вмедзений.
Ну, не жалію про це, бо якщо наша місія лікувати і допомагати дітям, якщо ми обрали цю професію, ми зобов'язані просто робити те, що ми маємо робити. І, звісно, це ярмо я на себе наділа на шию, і ми йдемо. На початку, коли я у Словаччині представляла свою презентацію, у мене було тільки кілька слайдів, що ми хочемо, ми готові. Пам'ятаєте? Так. А з кожним роком нашої співпраці у мене слайди зростали, і у мене була більша впевненість, наша команда зростала знаннями, практичними навиками. Ми навчилися працювати з цими дітьми.
Ми зразу з перших днів вірили, що проєкт буде успішним. Це раз. Друге, що проєкт покращить умови перебування наших пацієнтів, покращить якість надання допомоги, приверне увагу наших місцевої влади. Дійсно, місцева влада відгукнулась на зацікавилась цим проєктом і сприяла нам і у фінансуванні, і вирішували всі проблеми, які виникали у проєкту дуже багато. Навіть якщо ми врятували одну дитину, покращили якість її життя, то є проєкт успішний.
Катерина, дуже дякую за
Sme sa stretli v roku 2016, prvýkrát v Seville, kde sme začali prvé rozhovory. A odvtedy ja vidím obrovský posun na Ukrajine a to obrovské množstvo práce, ktoré si urobila ty a celý tvoj tým a vy všetci, ktorí ste tu, takže ja vám len držím palce a len pokračujte v tom, čo robíte. Máte Kaftrio, to je obrovské víťazstvo za veľmi krátky čas. A je pre mňa čest byť súčasťou vašej komunity a pomáhať vám. Ďakujem za priateľstvo. Aj s Pavlом.
Дуже дякуємо. Ми маємо до кави перерви ще доповідь від нашого друга, пана Павла. Це так, знаєте, як ми, можна порівняти наші такі відношення, як ну, багато з нас живуть в багатоповерхових будівлях, так? Коли ти маєш квартиру на одному поверсі з сусідами і з ними зустрічаєшся, і знаєш, що ти завжди можеш підтримати і їх, і вони тебе. Отак само відчувається ця підтримка зі Словаччини.
So we always feel this support coming from
Miło mi odwiedzać Ukrainę od wielu, wielu lat. Jeśli pozwolicie, to będę mówił po polsku, chociaż mówię po rosyjsku, ale wiecie, dlaczego będę mówił po polsku.
Добре, в нас є пані Уляна, трошки роби перерви, вона трошки поможе. Добре?
Dobrze.
Дякую.
Larysa poprosiła mnie, żebym powiedział kilka słów o naszej fundacji. Mikrofon.
Лариса просила мене сказати декілька слів про нашу фундацію.
27 lat temu powołałem fundację po śmierci swojego syna, który zmarł na mukowiscydozę i dlatego ta fundacja nazywa się Matio.
27 років тому я заснував фундацію після смерті мого сина, тому вона називається Матіо.
Postawiliśmy sobie 3 cele jako fundacja. Pomoc rodzinom i chorym, nie tylko chorym, ale też ich rodzinom. Rozpowszechnianie wiedzy o mukowiscydozie oraz rozwijanie współpracy z ośrodkami medycznymi w Polsce i za granicą.
Поставили
Dni wolne od pracy bardzo często organizujemy różnego rodzaju spotkania, eventy, akcje charytatywne.
How do we work? The foundation has its head office in Krakow, but it operates across the territory of Poland. Our staff is made up of 7 people. Every year we are using the help of approximately 20 volunteers. Since the beginning of its foundation, we were working as a voluntary organization. We don't take commission for our work. And at weekends, we organize different events, public meetings, fundraising campaigns, etc. We are organizing the annual educational campaign, social educational campaign, All Polish Cystic Fibrosis Week. This campaign includes training for doctors, medical students, and medical staff. We are organizing charity concerts for youngsters and adolescents adjacent to their learning activities, educational activities. We also introduce learning programs. We have educational events at different shopping malls, and during such events, we are trying to disseminate information about free of charge examination and preventive treatment. Every year, we are organizing masterclasses for parents and guardians of people who have cystic fibrosis within multidisciplinary care of patients. We also organize psychological masterclasses for parents and guardians of people with cystic fibrosis. We organize training for therapists and psychologists, and we also issue a journal once per quarter. The name is Matio, and this journal includes information pertaining to this disease. It is sent to people in our care and a wide circle of professionals. We also ensure systemic learning, which allows for better treatment and improvement of living conditions of people with cystic fibrosis. We support cystic fibrosis centers, and we also publish and translate materials dedicated to the topic of orphan diseases.
Wszyscy chorzy mają orzeczenie o niepełnosprawności, są objęci opieką państwa. W różnym stopniu mamy w Polsce 3 stopnie niepełnosprawności: lekki, umiarkowany i znaczny. I aktualnie w Polsce mamy zmianę systemu orzeczenia o tych niepełnosprawnościach, co nie jest zbyt korzystne, nie będzie zbyt korzystne dla chorych na mukowiscydozę. W Polsce mamy też 12 ośrodków leczenia chorych dla dzieci i 7 ośrodków leczenia chorych dorosłych.
The foundation takes care of 1,800 patients from across Poland and their families. All the patients in Poland have a disability, various degrees of disabilities. There are 3 levels of disability: light, moderate, and severe. And currently, it's relevant to introduce changes into the system of disability identification, and this will not be done for the benefit of patients with cystic fibrosis. And in Poland, we have 12 centers for treatment of cystic fibrosis, and 7 of them is for treatment of adults.
Jest to rozwiązane w zależności, każdy ośrodek ma inne rozwiązanie. Część korzysta z rozwiązań europejskich, niemieckich, ale nie ma czegoś takiego, co byłoby systemowo ustalone. Na razie jest to w fazie prób i miejmy nadzieję, że za niedługo zostanie rozwiązane. Jest też i w związku z tym jest duża dysproporcja między ośrodkami. Są ośrodki, może tak.
The Polish healthcare system does not have a worked out model of transferring children to the Cystic Fibrosis Center for adults. In Poland, there is a huge disproportion between the number of cystic fibrosis center for children and adults.
Jeśli chodzi o refundację, co państwo refunduje, to w Polsce mamy refundowane leki, wszystkie antybiotyki do leczenia chorych, łącznie z dożylnymi w leczeniu szpitalnym, leki przyczynowe od ubiegłego roku, od 2022 roku, od marca są refundowane. Mamy dofinansowania do zakupu sprzętu rehabilitacyjnego, do inhalatorów, flaterów, innych urządzeń. Chorzy, którzy mają orzeczenie o niepełnosprawności, w zależności od jego stopnia, mają różne wsparcie rządowe, ale też rodzice dzieci chorych. Mamy bezpłatne, co jest bardzo ważne, całe leczenie. System zdrowia, opieki zdrowotnej w Polsce jest bezpłatny dla chorych dorosłych. Tutaj jest tabela, gdzie jest pokazane, jakie są dofinansowania dla chorych i na przykład nebulizatory mamy 100 zł dofinansowania raz na miesiąc, inhalatory 400 zł raz na rok, inhalatory membramowe 800 zł raz na rok i różny sprzęt. Taka jest tabelka, którą rząd jakby dofinansowuje naszym chorym.
We refund the price of medicines, colistin, antibiotics, and specific treatments for cystic fibrosis. Inhalers, nebulizers, and flutters require additional funding, and parents of children with cystic fibrosis receive funding from the state depending on the type of disability, light, moderate, or severe. And inpatient treatment is free of charge. In the table to the left, you can see what type of reimbursement may be expected for medical equipment, meaning inhalers, nebulizers, and different expendables, as well as antibiotics.
6 lutego, 2 dni po wybuchu wojny, do Polski przyjechała pierwsza rodzina z Ukrainy, uchodźców przedwojennych i od tego momentu pomagaliśmy wszystkim rodzinom z mukowiscydozą, które przyjechały na teren Polski. Dzięki projektom później uzyskanym już pieniądzom od Euroordisu i od Vertex Pharmaceuticals udało nam się pomagać większej grupie rodzin i w sposób taki już bardziej szeroki. Nie tylko pomoc doraźna, ale też transport do innych krajów, też pomoc w nauce języka, w adaptacji w Polsce dla tych, którzy pozostali. Aktualnie w Polsce mamy już pozostałe rodziny na stałe, 33 rodziny, które są zarejestrowane u nas w fundacji, na takich samych prawach jak obywatele polscy, ale też jak nasi podopieczni, czyli mają dokładnie te same prawa. A w sumie przez pomoc naszą dużo przewinęło się ponad 100 rodzin, które emigrowały przez Polskę dalej lub też zostawały w Polsce. Część też wróciła na Ukrainę, część korzysta z leczenia do dnia dzisiejszego w Polsce. Tutaj naszym koordynatorem wspólnym był Przemek Marszałek, którego nie ma na sali, ale jak przyjdzie, to go tutaj zawołam i przedstawię Państwu.
Starting from February 26th of 2022 up until May the 31st of 2022, we've been implementing a program supporting families that have a family member with cystic fibrosis. As far as understood, we supported more than 100 families. Some of them moved further to the west, some stayed in Poland, and some returned to Ukraine. Thanks to the program, implemented together with Eurodis and Vertex, we were able to help people who wanted to leave Ukraine and those who wanted to stay in Poland. Patients who remained in Poland have equal rights with Polish citizens, and we currently have 33 families from Ukraine registered in our system that we provide support to, and we are also helping with humanitarian aid. And we have Przemysław Marszałek, who is the vice president of Matio Foundation, who is dealing with humanitarian aid and its provision.
To nie jest gołosłowne, bo zobaczycie go też tutaj na zdjęciach między innymi. To jest parę zdjęć, które udało nam się zrobić, ale nie chciałem w prezentacji zasypywać zdjęciami, bo znamy się bardzo, bardzo długo. Pytanie, jak finansujemy nasze działania? Takie pytanie, ja odpowiadam na pytania, które zadała mi Larysa.
And this is the answer to the question asked by Larissa. How are we funded? The foundation gets 100.5% from taxpayers.
To jest właśnie to, o co zabiegamy, żeby mieć dużo pieniędzy. Zbiórki publiczne, odsetki od lokat, działalność gospodarcza, czyli to, co możemy zrobić, żeby zarobić pieniądze. To między innymi organizacja konferencji, reklamy, sklep medyczny, który prowadzimy ze sprzętem właśnie oddechowym głównie, granty i projekty, o które się staramy, tak jak nasza organizacja siostrzana z Ukrainy, dotacje na konkretne projekty. To są międzynarodowe, krajowe, rządowe, darowizny i darowizny indywidualne, współpraca z innymi fundacjami korporacyjnymi, czyli takimi dużych firm.
So to reiterate, 1.5% of income tax may be donated. So it's a possibility for you to donate 1.5% of the tax to support different groups of patients. And it does help Matio Foundation a lot. Also, we have public duties. We receive interest, bank interest rates. We also have our own store, Matio Med. We get some interest fees from grants and some projects. And we also get gifts and donations from private foundations.
Weszliśmy do Unii Europejskiej. Rząd polski niestety nie finansuje działań organizacji pozarządowych w sensie pieniędzy na bieżące działania, czyli na prąd, czynsz pracowników. Natomiast dofinansowuje to w formie różnych grantów, które możemy czy projektów robić. Samorządy, czyli małe takie lokalne oblasti po ukraińsku, pomagają, dając na przykład lokale za bardzo niskie pieniądze, czyli czynsz, opłata za ten lokal jest bardzo, bardzo mała. Organizacje w Polsce nie mają żadnych zniżek na opłaty prądu, gazów, czynszów czy telefonu na przykład. Na to musimy sami zapracować. A po wejściu Polski do Unii Europejskiej, bo to było też jedno z pytań, no dużo się zmieniło, ponieważ Unia Europejska przekazuje bardzo dużo pieniędzy w postaci właśnie grantów i projektów na rzecz organizacji pozarządowych, dlatego że uważa, że to są dobrze wydane pieniądze i też tak ja uważam. Natomiast trzeba się bardzo mocno starać o to i to jest bardzo duża biurokracja. Niemniej jednak są to duże pieniądze, o które warto zabiegać, jeśli uda się Ukrainie w najbliższym czasie, czego życzę, wejść do Unii.
Support from the government and the EU. The Polish government underfunds the activities of the foundation, like maintenance costs, paying salaries, paying rent. The local government it subsidizes the activities of such foundations. So they get discounts for utility bills, and NGOs do not officially have any discounts for utility payments. And since joining the EU, the foundation was able to get financial support for the development and operation, and we also received different grants, and we were also part of some projects. So we are part of a number of big grant programs of the EU.
Właściwie 5 organizacji liczących się, zajmujących się tylko mukowiscydozą i tworzymy taki alians, który pozwala nam wspólnie reprezentować pacjentów przed rządem.
Here on this slide, you can see associations and organizations that our foundation cooperates with, and our foundation is part of all Polish federations supporting patients with cystic fibrosis. All in all, there are 5 centers supporting patients with cystic fibrosis in Poland.
Jesteśmy reprezentowani w różnych urzędach rządowych, w Ministerstwie Zdrowia, u Rzecznika Praw Pacjenta, Ministerstwie Polityki Społecznej czy Narodowym Funduszu Zdrowia i tam, gdzie decydują się losy chorych. Jesteśmy zawsze zapraszani do rozmów jako partner.
Matio Foundation is represented at the Ministry of Health, at the Foundation Protecting Patient Rights, at the Ministry of Social Policy, the National Health Foundation, as well as the government of the city of Kraków.
To są nasze dane. A ja serdecznie dziękuję za to, że słuchaliście mnie po polsku i sława Ukrainie. Dziękuję.
Thank you very much, Paolo. So that was our information. Glory to Ukraine. So thank you to the speaker. And I was told that the time has come for the coffee break. We did not really follow the agenda on this one, so I'm inviting everyone to the lobby for the coffee break, but we will have only 15 minutes for the coffee break. Can we please grab the coffee quickly and then be back here in 15 minutes to resume? Let us resume our work. Please take your seats. I believe that we've had a really productive day today. There are just 2 more presentations left, and you will have some time to have additional conversations. Once the first day is over, you can discuss the recommendations and proposals that have been put forward. So thank you for being this active today. And right now, I would like to give the floor to a person that I met not so long ago, but he has already taken incredible steps for the benefit of Ukraine. And here I'm talking about head of the NGO Підтримка України Олександр Вербіцький. So I will stand in one place. That's the requirement. We are constantly being limited. That's a joke, but thank you for the invitation. Thank you for what you are doing. You introduced me by saying I've done a lot for Ukraine, but this is probably not as much as compared to what our armed forces are doing and as compared to what volunteers are doing. So probably my team and I are doing everything that is a must-have for a Ukrainian at this time. And even when traveling to other countries, when I went to Austria to Elizabeth, I saw how concerned she was for Ukraine, and I was thinking that our people need to be at least demonstrate at least half the level of concern as she was. My name is Alexander Verbitsky, and I've never thought that I would be a founder of an NGO because I'm an entrepreneur. I've been an entrepreneur for 15 years, but our neighboring country decided otherwise, and because of the war, I'm constantly taking pictures with different types of weapons. So, what was I doing before the full-scale invasion? I wasn't really helping people. Sometimes somebody would approach me and I would help, but I was thinking about organizing events where people could help and we could help. So a month before the war, we did not have an NGO yet. I was just an entrepreneur. I was approached by some people or friends, and we were thinking how we could help people in this or that situation. So just before the war, a month before the full-scale invasion, so we transferred some equipment to patients with an orphan disease. So if there is no equipment available, then you need to have an ambulance, and the patient stays at the intensive care unit until the equipment is fixed. So I was informed that the equipment cost 500,000 hryvnias, and we were able to buy it for half the price, and we bought used equipment that happened before the war, but the majority of families with SMA just left Ukraine. And we were doing fundraising for different types of surgeries, including heart surgeries. So we provided different forms of support, but it wasn't anything systemic. We were doing it within our free time. But after the full-scale invasion, I just remember the first news that we were reading. There were 2 news that the majority of our international partners were citing: 72 hours and 96 hours. So they were thinking whether we would be able to withstand for 72 hours or 96. So nobody was scrambling to help us. So they were just watching. They were like observers. It was like a TV show or a video game. So they were just looking at the scales because it's not the best to support the loser, of course. And They were thinking whether it would take Russians a week or 2 weeks to reach Lviv, but thanks God, Russians were unable to get here. Thanks God to our armed forces. Thanks to all the citizens of Ukraine and such difficult situations. Uh, help Ukrainians unite. So there are two situations in which Ukrainians get united, either difficulties or some conflicts. So we have this next victim now, Miss Farion, or whatever her name is. She was fired. I'm not really aware of this conflict, so I don't know whose side to support, but I know that there are family members who are actually in the armed forces, and we are fighting against this person online. So we constantly need to find some enemy that we need to fight against. It's better, of course, to have a virtual enemy than an actual enemy who is killing us every day. When the war started, the full-scale invasion started, I was calling my friends in the army. I couldn't find the area in which I could bring the most benefit. I was trying to do my best using the resources, knowledge, and training that I have. But I received a call from my friend in Kyiv, and he told me that we needed to travel to Khmelnytsky and he needed a place to crash. And then I was receiving phone call after phone call, and I have many names on my contact list. So this is how I came up with my first assignment. I have two office facilities, one a marketing agency with the office is 165 square meters, and the windows are made of glass. The windows overlook one of the central squares of the city, so we were trying to put some tape on the windows. We didn't really understand what an air raid alert meant, so we slept on the floor, on the mattresses. Here you can see some IDPs sleeping in our office. So during the first 2 days of the war, our offices were full to the brim with people.
These were awful days. We didn't know what was happening because people were coming from under the shelling, and in the rather peaceful Khmelnytsky we had missile strikes, but not that many missile strikes. Happily, they didn't like Khmelnytsky that much. Well, recently they've come to like it, but our air defense works well. But our office was full of IDPs, but people still kept coming, and there were some responsible people to deal with them, but we should somehow be using it all effectively. There were long queues to the military recruitment offices, and I've had a marketing agency, and our team has got smaller because of the war, because half of our expert or my colleagues passed the decision to earn money. We started volunteering, but some of them, half of our people said we will still have to earn money. I don't know where they were gaining money at that point in time. Um, I don't know whether they felt any pangs of remorse, but somehow they did it. And so it was our second day, and I approached the city council saying that I've got IDPs, I need some premises. I was not thinking about other ideas, I was thinking only about that. So I told the city council that I need some premises in Khmelnytsky College, which is close to Lviv Polytechnic. This is the most powerful institution, educational institution in Khmelnytsky region. I asked them for those premises because we wanted to get the cyber army, so we wanted knowledgeable students. But we came there and there was no Wi-Fi there, so there were premises but no internet. Well, I understand that IDPs are in the office. I've got all the equipment, commutation equipment that I need. So we will bring the internet there to the college, and we will need the system administrator. I gave him a call. That was 9 a.m., but he was drunk, fully drunk. I asked him, why are you drunk? I told him, and he told me that he was just overcoming the stress. So I could not use her service. I just used the IT chat in Khmelnytsky, asking for the communication equipment. administrator. And Stepan, one acquaintance of mine who is a developer of the application that you have got about air alarm on your mobile phones, that was their idea. So I told him, we have got the premises, the office, please come. So we came there with all those laptops. We moved to Stepan's office. And in that way, we arranged the cyber front, the cyber army. That was a kind of a separation, a separate unit in Khmelnytsky. What we did was I took the managers that I had or who approached me, and I understood that they could manage something because people were just volunteering. They were coming to help, but we were not sure that they could work on something. So we had some managers who each of them had 10 people in subordination. So in the morning we gathered, I gave the assignments, and nobody knew what to do with all that. If you asked anybody what to do on the first or on the second day of the war, what to do, they would never give you a clear answer. This was kind of volunteering. I asked the servicemen to give us the passports of those prisoners of war or of those who have perished, and we were trying to find the good Russians, but when we came to understand that there are no good Russians as such, we were looking for photos of the perished Russian soldiers, and we're writing posts or comments under the Moscow meat factory saying that we've got meat for you, please come. So they were just doing something because we were angry with Russians, and that was a stress. We were watching the news from day to day, and on the basis of that, we were trying to understand what to do. So we were writing comments under the slogans of politicians. We wrote to different state institutions of foreign countries to be provided support. So we were doing whatever we could to disseminate available information. And we had about 15 people working on advertising, paid advertising. So we spent about 500,000 hryvnias over the first 2 weeks of the war to start disseminating true information. That was paid advertising that we launched abroad. These were boys and girls who are 18, 20, college graduates. That was really something cool that they did. Unfortunately, we didn't have any security. I was very much afraid of them. I just had some hunting guns, and I just asked some people to stay with those guns at the entrance. And when people were trying to come to us, we were afraid that they could drop a bomb or something like this. So we were trying to check the identities of those people. That's what it looked like. Good evening, we are from Ukraine. We were all afraid, but nobody showed this. Well, there is no geolocation in this video. There are no faces. This is the city mayor of Khmelnytsky. And after that, we started looking for resources, and we started training teachers of computer sciences for them to further engage senior students of schools and university students. So that's a short story. Well, that's all about organizational issues. I was organizing something and moving on. But on day 3, we understood that we will not be able to host all IDPs. And these IDPs gave the phone number of my colleagues responsible for this direction to others. And my colleagues really had their phone ringing all the time. We understood that we were supposed to help those people. And we created a group and motivated gyms and other premises where there was a lot of space. We chose some friends with rehabilitation centers or gyms, and we asked them to create IDP centers, collective centers. We already had the standard. We scanned the passports of those people, so we did everything for security considerations because, you know, there was sabotage, diversion groups back then. It was not safe. And we created the registry of the people who are hosting IDPs in our city. We were coordinating this hosting activity, and besides that, we were responding to phone calls and doing referral. Suppose somebody is giving a call saying that I'm coming with 3 children. Okay, we need to have a warm place. I'm coming with a dog. Okay, you will be hosted there somewhere in the periphery. So we were gathering information and somehow providing these people with vacant places. And then after some 3 weeks, the state authorities finally started doing the same. Then I understood that we need to have an NGO. You know, that sometimes we may have very good intentions in our country, and then false information will be disseminated about you, or you will be imprisoned. So I understood that people were donating money to my card account, and we were bringing humanitarian aid for that money, but I understood that we needed to digitalize that, and I need to have documentary confirmation of what I'm doing. So we launched an NGO. We didn't understand what it should be dealing with, but one of the ideas was that we needed to train IDPs. We needed to give them some knowledge, some information for them to get distracted. So we launched the training courses for IDPs. And it's really funny. After 2 days after I launched an NGO, controlling authorities reached me and asked me what for I created this NGO, because there were so many vague NGOs in the country established recently that they wanted just to know what I was doing. So we had this training for IDPs. Actually, we were working in parallel in different directions. And what was cool, what was a very good experience, maybe somebody is going to borrow this experience, was that over the first 3 days, people came to the training with very concerned faces. They were rather dull. But a week or two later, these people were transformed into people staying in good mood, who were already friends, who were looking for the job, and we gave them computer literacy skills, marketing skills, and as far as I understand, 70% of those people have got employed. And I also remember that someone from abroad, from Poland, seems to me, told that I will have to bring a stove for the servicemen to one of the military units. So I went to Nova Posta, took it, went to the military unit. Well, that was about 2 months of the war. And he said, "You have come here, but for 3 weeks nobody has been coming here." I asked him why, because, you know, I was doing with IDPs, with cybersecurity. I was not trying to help the army because everybody was trying to do this. The way we had been helping physicians in the first days of COVID, when war broke out, we were helping the servicemen. And he called me the last of the Mohicans because nobody came to that military unit. There are different military units. Some of them have a good PR manager, a good recruitment manager, and that's true that it should be that way. That's the right approach. But after that, we decided to help the army in different directions, and all the cars, generators were not bought for some donations. People often ask us whether we have some account to which the money is brought. No, all the money is for some products. We have created something people donated to, and then we spend the money for the armed forces of Ukraine. So we don't have any donations coming from abroad. Well, it was once 500 euros coming from abroad. No, it's all about our activity and our products and services. Also, it so happened that I went to Germany, and a friend of mine told me that they needed some assistance, and whenever we can now, in cooperation with foreign organizations, we are bringing humanitarian aid. So it seems to me our colleague Oleg tomorrow is going to Austria to take some humanitarian aid. So this delivery of humanitarian aid was a starting point for what we did for the army. So thank you for allowing us to help you. I don't consider myself to be a volunteer, because a volunteer is a person who should be dealing with volunteering on a permanent basis. Besides volunteering, I also am doing business. I have regular sports activities, because you need to somehow switch your mind to a different direction. So for me, volunteering, this is a screenshot. You know, I have a file on Google Disk where you should definitely have letters, a letter for everything. Whenever you need to convey some or to transport something, you need to have a letter. Then definitely you need to have a report. And on my table, on my desk, I have a large pile of such documents. These are kind of handover certificates. You need to have pictures. You need to have documents. You need to have a paper report and photo report, but if it concerns a car or a binocle, then you must also have a guarantee letter from the military unit of a certain standards. It seems to me I can already be a counselor in this area. So volunteering for me goes for 30% of bureaucracy, which is not probably bad, because we also made some procurement in cooperation with the state authorities, and we bought some goods from those who were selling property for the armed forces. And we acted as the charitable foundation that seemingly buys this and transfers it. So this was the basis for our cooperation with the controlling authorities, and really these goods were transferred to the armed forces. So a lot of bureaucracy, which is still an obstacle, and then I came to realize that within those circles you're going from one circle to the other and you don't quite understand where you are. Let me give you an example. I was bringing medicines and starlings, and the customs officer at the border told me, give me some tips for coffee. I tried to ask him, what for? Why? This was the Hungarian border, our customs officer. And he said, well, you are bringing two jars of my sports nutrition, opened bottles, open jars. And there is the security service present there at the border, and he told me, when you're entering, why are you can see the security officers there, why did you put your hand into the pocket? And he made 3 times a hint that I should give him some tips for coffee. Of course, he didn't get the money. I didn't have a quarrel with him. I just left. But that's how I felt. I felt frustrated. I always tend to somehow leave those circles. Or, for example, I had a case in Lviv. In the city center, was supposed to have a stop, and somehow there was a car. I could not somehow evade this car. I went to I went further, and there was the police car for some reason that was trying to give me a fine, 500 hryvnias or something like this. Okay, I didn't say anything, but some 300 meters after that, I was going using the GPS. I entered the city center, and it appeared that there was a sign that you cannot go there. Either it's a recent sign that is not in the GPS yet, but I went there, and again I was stopped by the police. I saw that there were 2 police cars there at that sign. They were just looking for someone to go in that direction. So I told what I was thinking about them, and they let me go. But that is the sense that sometimes you don't understand whether everybody really working towards the victory. They were just drinking coffee there and staying there. I'm brought sometimes when people stop me and I'm a Ukrainian, they see it by my passport, they let me go, and they even explain to me how I should go. So the police understands that I'm not from that country and that I'm a Ukrainian, and they are trying to help me to show the direction. How do we engage the resources? So here are the projects I'm dealing with. I've got different projects with different partners. These are the courses for children in the marketing agency, and we have a running agency. We also sell sports nutrition. So for the first 3 months, we did not deal with business. We dealt with volunteering. But after 3 months, I told the managers that we can try and restore our business. And all the money that we earn could be spent on the salaries. After COVID, I made a survey, and the average savings of people were for 20 days, enough for 20 days. So I understood that people needed some money. They would need money to get some food. But the question is, if you want to eat and you have a family, you don't have money, you will try to steal something humanitarian aid. So for people not to be stealing this humanitarian aid, you should give them opportunities to earn some money. But we went further. We launched online running, online marathons. That was actually the idea generated by my partner, but that is a commercial idea. But 10% of our profit is spent on the armed forces, which is quite a heft amount. So a person can get registered on our website, and in 2 or 3 days, he gets the starting package, like the number for the marathon, a medal, like with the guy in the middle picture, and a lot of gifts from our partners coming in this sort of package. We've got more than 10,000 people who have run our marathons, and as a result of that, we also get an opportunity to donate. And we play with those medals a lot. You can see that our medal, well, I've not taken it with me, but there are 3 shells in it, so, or it's in the form of the trident. Well, you know, it's really nice. And when those live marathons started, when you can get real emotions because they are offline, it's easier to sell such marathons. But even when we had the high competition, we still had about 1,700 of people registering for our online marathons. Besides those marathons, we add all our attributes like the medals, the bracelets on the website, and 100% of the money is spent on the army. So here we have people who just buy those things for gifts or something like this, and we can do something as a result of getting this money. We went further. We started arranging charity marathons in Khmelnytsky. We had the medals, and we decided to arrange the charity marathons in Khmelnytsky. The average number of the participants was 200. The largest one was for 1,500 because we organized this together with the border guards. And of course, all the money minus the costs of the organization were spent on the army. Seems to me that this marathon resulted in the procurement of the drone. That was this marathon with the State Border Guard Service of Ukraine. They have the attack guard called the Steel Border, and we collected quite an amount of money. It was about 75,000 hryvnias, and we bought power banks for them and the thermal imaging devices. So a lot of border guards really got engaged in this marathon because in Khmelnytsky we have the Academy of the Border Guard Service. And here is an example of our marathon, the video. We engage the servicemen, we have some trophies, we have the photo area. The slogan is, I support the steel border, and the Border Guard Service even provided their orchestra for that event. The oldest participant was about 89 years old, close to that, maybe 85. And he, by the way, he was not the last to reach the finishing line. We also cooperate, just 2 minutes, okay. It's very easy for us to cooperate in Khmelnytsky with the city council, with the state military administration, and we never faced any barriers. Everybody's trying to support us. So I cannot tell that I have ever seen cases of kind of treason or that they owe disloyalty to us. Besides that, we are arranging a lot of games, a lot of fairs for children. We are doing everything using the resources of our staff. We don't have volunteers who are just coming and we pay salaries to them. We spend 15% of our money on the administration resources. We're just doing all this with our own effort and sending all the money for the armed forces of Ukraine. And by the way, Young Business Club, who has reposted that they are so bad because there has been a recent row with Azov, and did you put a like there? Did you repost it? Because there was the same scandal with Young Business Club as with Farion. The one girl, some administrator, told the girl from Azov, please take your seats at the back benches because someone is afraid of something. And this girl, for some reason, told this. It's not the whole club, but you know, Ukrainians are good in dissemination of information, which is scandalous information. I have a post with the Young Business Club on the webpage of Instagram, and there are 3 negative comments with under that post where I'm also present. But they gave us $1,500 for a drone, so they are good, I would say. And here are the medals, here are the charity marathons. We are going to different events. Here is the biathlon championship in Vinnytsia. We were just selling the illustrative books to children, and we're earning money. And here is the Jiu-Jitsu Academy in Khmelnytsky that also had a charity event and gave us money. Also, a rehabilitation expert came to Khmelnytsky, also gave the money to us. So volunteering is about reporting. We always have paper documents and photo accounts, photo reports. I was thinking why we are doing this. And you know, today on my way from Kyiv to Lviv at 9 in the morning, I was on the train, and in Intercity Plus, maybe you were also on that train. Did you hear what the operator says at 9? We will have a moment of silence now. I first didn't understand this. I didn't understand what kind of 9 a.m. it is. But how many people stood up? I was really frustrated because when this minute of silence started, I didn't understand what was happening. I stood up. The carriage was half empty, and only people who were sitting close to me, you know, I have the Azov T-shirt. Maybe they got afraid, and when they saw that I stood up, they stood up as well. But the other part of the carriage that didn't see me did not stand up. They didn't have any motivation. I was trying to process this information. Nobody stood up. So what does assistance provide us with? Your conscience is clear. I'm always afraid that I'm not doing the best what I can. I think that most of us have already been to military funerals or to the military hospital, and we are really doing not enough. We need to express our gratitude all the time. We always express gratitude to the people helping us. And here are 2 slides about plans. We are launching the New Horizon veteran support plan. We have a lot of amputated people with amputated legs or arms. And here is my colleague Andriy, who will work with rehabilitation. He's come from Denmark. He was in Denmark when the war broke out, but he came here specifically to defend Ukraine, and he lost his leg. So now we're working together with him on the project that will help veterans. Just enter our social media pages and you will see more information. When I'm invited, I always bring some gifts. So here is a package for the organizers of this conference. These are the packages like the ones we give to our marathon winners, with some tea and some sweets. And besides that, we understand that you are related to the healthcare field, so we don't have any discounts for our projects dealing with sports nutrition, with vitamins, but there you have the promo code and you can use it. There will be a 20% discount, and we are also ready to help you if you need some products from abroad. Since we are working with a lot of suppliers, we are ready to bring those products to you at prime cost and give these products to you, because anyway we're dealing with this. That's what ChatGPT wrote. I asked it, I want a very inspiring phrase. Victory doesn't come to those who are waiting, but comes to those who are trying to move towards victory. So let me wish all of us to be going towards victory. Thanks a lot to you. Thanks to foreign partners for what you are doing, and glory to Ukraine. Alexandra, I'm really grateful to you for a very interesting speech. I'm grateful to you for what you and your team do, and I was really impressed when we came to Khmelnytsky and visited you. We were not acquainted with you offline, but then we got acquainted with you offline, and people were so much open. They wanted to treat us with something. We saw you for the first time, but it seemed like we had known each other for ages. So it's like one family. Thank you for support. Thank you for what you're doing. And greetings to your colleagues. So, colleagues, we have one reporter left, and at the end of the day, we will have a very interesting video. So I would ask you to still be patient enough. And please, Yuri, he's our friend, he's our guru, he's our teacher who has taken us first to the kindergarten, then to school, to college and university. So that's what he did. When we were launching our activity and were afraid of grants, we didn't know how to write grant applications, we didn't know how to deal with reporting, we thought that we would need a chief accountant, and here we have the chief accountant who is always helping us to settle all the issues and to deal with the reporting asked for by our partners. So please, Yuri, you're very much welcome. But just try to be brief. Yes, thank you. Thank you for the presentation, for the introduction. Glory to Ukraine. Happy to see all of you.
Indeed, thank you for your introduction. I see that you are ready to listen to this final presentation. And Larissa, during one of today's panel discussions, you mentioned that I was never a trainer for you, but I perceived it quite as an offense, but we did have some joint training, right? When I was elected the president, I came back home on that same evening and I told my husband, "Oh God, what am I going to do? I don't know what to do. It's an All-Ukrainian association. How do I talk to people? What do I tell them?" Of course, it all comes with time, but indeed, I'm really happy and today, listening to your presentations, hearing about your achievements, how you are helping parents, I hear positive feedback. I also listen to the positive feedback of international partners. I understand that all of you, Larissa and the board, were able to achieve these results. The most important thing is the internal motivation, and I agree with the previous speaker, Alexander, if I'm not mistaken. Some 20 years ago, I also had a small business. I was an entrepreneur. I no longer remember what being an entrepreneur is. I'm constantly involved in civil society activities these days, and I've forgotten what being an entrepreneur is. Having motivation is having faith in our good deeds, and in fact, what you're doing, the things that unite you are primarily lives of people and lives of your children. And life is the most valuable, the most important thing in our life. And the slogan of our organization is Fight for Life, because we are fighting for all lives. We are trying to cover more programs, more nosologies, but I started out as part of a patients organization, and I started working with civil society organizations because I had a disease myself, and I realized that I was able to continue living because of these civil society organizations. So I started sharing this knowledge and inspiration with other civil society organizations. If you are thinking that you don't know what to do, just as Larissa told us, when I was elected president, I didn't know what to do. So let me tell you, you are not born with that. You can train it, you can grow it in yourself. And if your motivation is fight for the life of your kid, I think nothing will be able to stop you. And you will be able to learn everything: how to write request letters, how to talk to your partners, how to go to this or that official, how do you talk to foreign partners if you don't speak foreign languages. It all comes with time if you understand what your end goal is. And Larissa asked me to tell you a little bit about life during war, life of civil society organizations and challenges. I will tell you a little bit about our organization. At first, last time we met on the 23rd of February of 2022. We had an online meeting because of COVID. We were discussing advocacy and budgets during the first day, and then on the second day, the war broke out and we didn't have a meeting, and I was coming back home and we were already planning the future actions of our organization. It was probably easier for us as compared to other organizations because we were preparing for the war. Our organization was preparing for the war. We talked to friends from the United States. We were doing planning together with a military psychologist, discussing challenges, discussing how you should react and behave. And a week prior to the full-scale invasion, we had a meeting of all Ukrainian centers. I was thinking to myself that the knowledge would not come in handy. I didn't think that the war would be that large scale, but we were told what were the things that we needed to be prepared for. We were told that there would be chaos, that we didn't need to go and scramble to get some weapons. So the things that we were told, they turned out to be a reality in the result. So when the war broke out, we had a general meeting, and I'm grateful to our team because the majority of team members stayed in Ukraine. And before the war, we understood, before the full-scale invasion, we were trying to get ready, and we realized that we had patients who were dependent on us. We are also providing social support to people with tuberculosis, with AIDS, and we already stocked up on medicines on the all-Ukrainian level. 2 weeks before the full-scale invasion, we relocated our stocks to the west of the country. So we told others that medicines needed to be stocked up, and people told us that we needed to go and have a barbecue, but we were using our resources to get ready. And I'm sure that your organizations were also doing something when the invasion started. I know that Rivne region is a little bit removed from the front line, but I know that medical centers already lacked staff and our workers were distributing medicines to people. Rivne region was like a transit region. People fleeing the war were traveling through Rivne region, and many people were fleeing without any medicines. People did not have medicines stocked up, and as you know, treatment cannot be interrupted. And we also had a corridor. We didn't have an infinite talk on medicine. So if a person was moving to Zakarpattia, then we gave them a small dose and contacts of a person that could later provide them with additional medicines once they've arrived. So I'm sure that in your communities you were building such chains, and you were providing targeted help, and you were probably sharing medicines for your own children with each other. And we know that we are unbroken, and I'm really grateful to all civil society representatives. So many people are thinking about the government. Many people try to think about international partners. From what I'm seeing, the government and international partners have other things that they are thinking about. So let's have a look at the reforms. And just looking back at the Revolution of Dignity in 2004, who was able to have the revolution? It was the civil society. In healthcare, what are the reforms that could be done? It can all be done with the support of civil society, the judicial reform. All the other reforms are taking place not because the government wants it, but because the civil society wants it. The same applies to the full-scale invasion. During the first days, we were able to withstand because of people, because of the civil society, because people started helping the servicemen. Some people took arms, and I'm talking to guys from territorial defense forces in Kherson region when everybody, the police just fled Kherson, and the local men just took arms and they tried to defend their city, and they were just shot. So Kyiv was able to stand because of local people. So Kyiv is a big city, of course, we just gave away weapons to people, and this is how we were able to withstand. So some people took that firearm or machine gun for the first time in their life. They were never preparing for that. So everything is in our hands. We can achieve everything. I don't like to be monotonous in my speeches. I like being interactive. I like interaction with the audience. And I know that tomorrow there will be a planning session. And I will be interested to hear about your vision of your organization. What are the challenges that you are facing on sites? What are the problems that you need to solve? So you can just express your vision in a couple of sentences, and what are the challenges and problems that we have on the national and local levels. So I'm happy to see some familiar faces here in the audience. I'm happy to see new faces, because I know that in many organizations, one of the challenges caused by war was that many leaders left Ukraine, and in many organizations, leaders moved to different countries. I'm never judging people. I do what I want to do, and I'm going to move forward in that same direction. So I'm seeing that there have been changes in some regional centers, changes in leadership. I don't want to do a roll call now. Thank you for this very apt question. It's really interesting how the audience cooperates with our speakers. So it's really useful to have this cooperation. And of course, you may think about your vision of the future. While you're thinking, may I answer this question first? Yes, it's a question for all of you. So this is the thing that came to my mind. So my objective is to do everything possible in Ukraine in the sphere of cystic fibrosis, and in our organization in particular, so that we can have a platform that will be working regardless of who the president is, regardless of who's the minister of health, regardless of who the president of the country is. I definitely understand, and maybe I see that in the future I will be doing something different, but again, regardless of who the president of the association is, and again, notwithstanding who our top authorities are, I want for the system to work like a clock. So this is my objective. And what is the system of your organization? So you mean the system inside your organization or on the national level? Both. I'm really happy to see new faces here, new faces representing different regions, and I'm really happy and I'm really grateful to men sitting in the front rows. They approached me during the break, and they are interested in what's happening in their region. They want to change the situation, and it's great. It's so great that we have people who care. So I think we are on the right track. Thank you. Thank you, Larissa's just set an example for all of you, and in the meantime, I'm waiting for your answers. So while you're still collecting your thoughts, let me tell you, when you're asked a question, how do you see the processes happening in the country since the beginning of the full-scale invasion, I can tell you that we cannot compare the situation at the very beginning of this year and what is happening even right now, because the civil society, the government, and the donors are changing the directions of their work. And I have this recommendation for you. You need to be more realistic, because our partners and friends are thinking about some deadlines. So first everybody was thinking whether we will give up in 72 hours. Now everybody is thinking about the counteroffensive. Then the next deadline is the victory. My team and I, we are planning. We're trying to plan for the future. It looks like this war will be lengthy. It will be difficult and international support will be depleting. When the war just started, we were able to withstand. We kept Kyiv and we received lots of humanitarian aid and medicines. Then 6 months passed and then we were facing the issue of lacking medicines. Again, the budget of the country will decrease because right now we are receiving help from international organizations, and the more reasonable, the more down to earth we are, the better. So you are telling me that my time is up, but according to the agenda, we are finishing at 6. No, I was supposed to finish my speech at 10 past 5. Okay. So maybe just very briefly express your thoughts. So how much time do I have? 10 minutes? Not 10, but 5. So what are your expectations for your regions, please? Or on the national level, what are your expectations? Are you being modest? So let me tell you, but please use the mic. I'm Volodymyr Shvachko. I'm a new person here. Maybe a new person for some of you, and not such a new face for the others. So our expectations before the victory is to do a lot of work. First of all, we want to create a really strong system. We've already created one in Dnipro, a system for children. So today, children have the opportunity to receive medicines. We have permanent funding, and if some issues are not solved right away, it takes us a maximum of a week or two to solve some global issues. We were having some problems with Creon. There was a kind of a misunderstanding, and we had no Creon in the region at all. And because of a great deal of work that I was able to do before becoming the head of our regional center, we were able to supply Creon to the region. Our key task before the war is to stabilize the situation with the children so that our children have maximum coverage. And with regards to adults, we have just started our work in this direction. Why is that so? That's because I was elected the head of the Center for Dnipropetrovsk region just in September, and before that nobody was actually doing anything in this direction. And number two, these are adults that we are talking about. And by the time that we win, I'm also a serviceman. On the 25th of February, I was already a member of the Territorial Defense Force. We traveled across Ukraine. I was not staying in trenches. We were the 98th Battalion of Azov. Then later we became part of the 3rd Assault Brigade. And my task as of today, I'm a person with many interests. I'm an entrepreneur. I'm involved in defense. I'm involved in healthcare. But our primary joint goal is to prevent the enemy from breaking our system. And we need to give the people in Ukraine who want to think differently, and we need to give them the support, and we need to show them that there are people in this country who will prevent the enemy from destroying this system. So that our children and grandchildren always have access to medicines. Thank you.
Thank you. It's a very good example, and thank you for protecting us. And here are some small recommendations. If there is a new person, well, the main thing is medicines. I'm really proud of the activity of your associations. If you are facing some local problems, the main thing is for you to know what you want to achieve. So the main thing is medications for your children because life depends on them. So that's why our organization keeps fighting for medications. You can get them from abroad through local procurement and national procurement. You need to be clear about the documents. You need to know what comes from where, and I think that you can get some recommendations from the national level. But if you want to look for donors, also address us. We are always side by side with you, and we are ready to help you. The main thing is for you to be willing to do this. Don't give up, and definitely your team will be enlarged by other people, and we will overcome all those barriers for the sake of our children. So good luck to all of you, and quick victory. Thank you, Yuri. Before the war, we were intending to hold a conference. We had one day of the conference, and then we had those missile strikes, and Yuri was going home to join his family there. I remember that. So now I would like you to watch a video that describes what we experienced. It reminds us of our reality, of who we are, of who we are supposed to be, and I would really want all of us to be united and to be helpful to each other. Let's watch the video.
Crossed our bodies heartlessly. One day we felt pain in our hearts. We saw destroyed cities. Went to the front voluntarily. We will protect our nation. Today I scream about it. Where is my Ukraine? Now I know we will defeat them. We're not afraid of snow or rain. Our warriors are brave. Now they hold our sky for our freedom.
So, colleagues, I would like to say that in this room we now have a very special person, very special for me. This is my elder daughter who has gone as a volunteer to the armed forces of Ukraine, and she is now defending me and my family, my motherland, our Ukraine, my Tanya, the senior soldier of the armed forces of Ukraine. Glory to Ukraine. I wanted to tell that when we came home to Kyiv from Khmelnytsky, she went to her workplace. She used to work in a bank, and she said, I can no longer be standing this. If husband can go and defend Ukraine, let me do it. And I, as the mother, was really frustrated about that, but she told me, Mom, and what did you expect from me? I'm the same as you are. I'm stubborn. So I'm really grateful to you. Stay safe. Let you stay safe and let all our defenders stay safe. Would you like to say something? No, I'm really very much concerned because I've seen my mother finally. Thanks a lot to everyone. So tomorrow we will continue our conference. And I'm really grateful to everyone for productive work today. In case you have any questions, you're very much welcome to prepare them for tomorrow. And I think that everything is going to be fine. Stay safe. Have a nice and calm evening in such a comfortable city of Lviv. Thanks a lot to our host, to the physicians who are present here. Thanks a lot to all the Lviv residents. You've actually hosted the whole of Ukraine. We are proud of the fact that you are our reliable rear in Western Ukraine. And have a nice evening and see you tomorrow. Thank you.